viceprincipal director. Buenos días.
Good morning. Welcome to today's session for Thursday. As you were informed yesterday, the President, the Health Minister of Guyana, had to leave last night, so the Vice President will take over today. This is El Salvador, and we have Minister Francisco Alabi, who will be chairing for the entire day. Minister Alabi, you have the floor. Good morning to everyone, and it is a pleasure to be here, but I want to also greet warmly all of us at the 176th session of the Executive Committee. It is a pleasure for me to participate, but especially to be able to reach many agreements that are a benefit for all of the countries in the Americas. So warm greetings, Dr. Barbosa, Executive Committee, and all of the representatives of the countries that are part of this continent. Without further ado, let us begin today's session. I propose that we can look at the pending proposed resolution on chronic diseases, and that we leave that for after the first break and move on for the time being to agenda item 7.7.
Puntos.
Agenda item 7.7, Policy on Research for Health Final Report. I would like to bring document CE 176/INF/7 to the attention of the committee and invite Dr. Sebastián García Saizo, Director of the Department of Evidence and Intelligence for Action in Health, to come to the head table and present the item. Dr. García Saizo, please.
Thank you, Mr. President. President of the 176th Executive Committee, honorable delegates to the Executive Committee, Director, colleagues. It is my privilege to present to you agenda item 7.7, the final report on the policy on research for health. This report responds to the mandate issued in 2009 through Resolution CD 49R10, when the Directing Council adopted PAHO's policy on research for health. The aim of the policy was to promote the generation of relevant, ethical, and high-quality research, which entailed strengthening research governance, standards, and competencies, and fostering the dissemination and use of research findings to advance health. This final report marks a significant milestone. It provides an assessment of the progress made in the last 15 years and the pending challenges to conduct high-impact research that is relevant for the needs of people in the region of the Americas. Research saves lives. It is necessary to find cures for diseases and effective health interventions. The COVID-19 pandemic was a powerful reminder that research has a direct impact on our health, our well-being, our economies, our security, and our self-sufficiency. The pandemic also revealed the strengths and limitations of our research ecosystems. It showcased the measurable progress made by member states over the past decade and a half. Over the time this policy has been in place, the research output of the region has increased dramatically. The region has made significant progress and scientific contributions in priority areas like Zika, and the growth of innovation in some areas, such as biotechnology, has exceeded the pace of traditionally stronger research economies. The Pan American Sanitary Bureau has continuously provided technical cooperation to develop research agendas to meet health needs, and to strengthen frameworks to align with international ethical and regulatory standards. The Pan American Sanitary Bureau has further developed tools and guidance to conduct ethical research efficiently, enhance the impact of research results, and ultimately ensure that evidence informs health decision-making. However, some challenges persist. Chief among them is limited investment in health research. Despite progress, public funding for research in Latin America and the Caribbean remains far below global benchmarks. Studies tend to be small and repetitive, thus not capable of yielding high-quality evidence. Logistical and regulatory barriers hinder the conduct of large-scale, multi-country clinical trials led from within the region, limiting the potential for truly impactful, coordinated research efforts that meet our region's needs and thus address persistent disparities. Despite improvements in governance, many countries still rely on frameworks that cover only a subset of health research or unduly restrict valuable studies, such as pediatrics and pregnancy research. Confusion between regulatory and ethical oversight leads to both duplications and failure to take on essential tasks required by international standards. Along with stronger research capacities, efficiencies at the regional level ought to be devised to accelerate clinical trials that meet the needs of the region. The report emphasizes several key lessons that should guide us moving forward and harness the power of science for health. Firstly, a systemic approach to research governance, rooted in indicators, is essential for sustained progress. 2, trust in scientific research must be nurtured. We can only do research if people enroll as research participants. Transparency is key to foster research participation and trust in research outputs. Third, scientific research is foundational to development. Investment in research not only advances health, it generates economic and societal benefits, including jobs and economic growth. 4, research is necessary to reduce disparities in health and well-being. Health for all will only be achieved if low and middle-income countries are capable of leading the innovative studies that meet their specific needs. We must therefore promote locally led research, support young scientists, and build regional capacity in emerging areas such as genomics, artificial intelligence, and precision medicine, where the region can also have a competitive advantage. Finally, scientific research only saves lives if its results guide practice and policy. We must ensure the uptake of research results and devise strategies to ensure health decisions are systematically informed by evidence. The report concludes with a clear call to action. It urges member states to scale up efforts to advance health research, to adopt the recommendations from the WHO resolution to improve the quality and impact of clinical trials, and to act on the lessons learned during the pandemic with support from the Pan American Sanitary Bureau. The Executive Committee is invited to take note of this report and offer its views on how we can deepen and sustain this agenda and take further action to ensure research translates into better health and greater well-being for the people in the region of the Americas. We remain committed to working hand in hand with all member states to ensure that research for health continues to be a force for progress, innovation, health, and economic growth in our region. Thank you.
Muchas gracias, doctor.
Thank you very much, sir. The Executive Committee is invited to take note of this report and provide any comments it deems pertinent. I will now open the floor to the plenary for discussion.
Concedo la palabra.
Brazil is recognized, followed by El Salvador. Thank you very much, Mr. President. We're grateful to PAHO for presenting the final report on the policy on research for health. Brazil recognized the importance of the topic, especially at a time where false news is bringing consequences that are harmful, especially when it comes to health. Brazil supports the need, what it says in the document, the need to strengthen institutional resources and human resources and focusing on science and technology regionally, having ethical and transparent management in health research. Allied with this policy, our country has prioritized the nexus between public policy and science and health sector. In this regard, in 2025, the Ministry of Health of Brazil will invest in project research for women's neglected diseases, oncology, and unknown diseases, or not well known. We have a commitment that the scientific knowledge must really focus on the needs of our populations. Let us also point out that the Brazilian experience by creating a health research committee will ensure better effectiveness of the evidence generated. In this context, we reiterate the strategic importance of health research as a structural element to strengthen and ensure the sustainability of health systems, as well as our commitment with the ecosystems for innovation guided by the needs of the population and that promote a process to implement research results. It is with scientific knowledge that we will be able to continue saving lives in this environment with so much fake news. Thank you very much.
Concedemos la
El Salvador has the floor. Thank you, President. El Salvador takes note of the report, and we're grateful for the technical cooperation offered by PAHO to encourage research. There is a need to conduct scientific studies not only as a country but as a region where the pathogens don't respect borders. We consider that future research should be to implement policies and eliminate diseases such as the current approach. At the same time, we believe that we need to manage health with equality for all and all member states with a focus on one health for all. Thank you very much. Thank you very much. Chile is now recognized. Thank you very much, Mr. President. Since approval of the research policy for health in 2009, PAHO and member states have made important strides. We have seen how research has been a key driver to better understand our biological realities, develop more effective interventions, and base public policy. However, as the report clearly points out, there are still challenges and they are actually even more complex with the appearance of new threats to global health and the growing inequity in access to knowledge and its benefits. Investment for research is not an expenditure. It's a strategic investment in the future of our people. It is through research that we will be able to find innovative solutions to persistent health problems, develop tools and technologies that are adapted to our context, strengthen the health system so that they become more resilient and equitable, and fundamentally reduce gaps in health affecting millions of people in our region. We take on the task of continuing with a research policy in health that not only requires financial commitment, but also a political and technical commitment to strengthen national research capacities, promote regional cooperation and intersectoral work, ensure that research is carried out at the highest ethical standards, with active participation of the communities involved, and also promote the knowledge transfer. Thank you very much, Mr. President. Thank you. We now offer the floor to Guatemala. Thank you, Mr. President. The delegation of Guatemala is grateful for presentation of the final policy on research for health final report, and to promote research that in the framework of ethics promote health, reducing inequities by generating knowledge to guide decision-making, guide actions, promote public policies, and improve the country's health situation. We echo the recognition of the challenge posed by financing for this topic and understand the relevance of this policy. Guatemala takes note of the report and also would like to support the use of research for innovation through collaborative work both nationally and regionally. Thank you, Mr. President. Thank you very much. Mexico is now recognized. Thank you very much, Mr. President. Mexico acknowledges the importance of research for health for the development of our countries. And in particular, right now we are strengthening the areas in the ministry that focus on the topic. So we are grateful for the support and all the information shared by PAHO with us to develop the topic. Thank you very much. Thank you. I now offer the floor to Dr. Garcia Saiso to respond to these comments. Thank you very much, Mr. President. I'm very grateful for all the comments expressed, in particular Brazil, El Salvador, Chile, Guatemala, and Mexico, who furthermore reiterate the commitment of the region to move forward in a policy to strengthen health research, and this has been ongoing for 15 and a half, practically 16 years. There is no doubt this is a policy that, as the report points out, has reached the end of its cycle without it detracting from the importance of the topic. The reiterated commitment is to continue working with the countries, reinforce the bases that have been already achieved, these blocks that help us strengthen health research in our region, and have a shared path to meet not only research needs, but also the need of evidence and knowledge, and this should be done transparently and for the benefit of our peoples. Thank you very much. Thank you very much, Dr. Garcia Saiso. Director, would you like to make any comments? Yes, Mr. President, thank you very much. First, I'd like to welcome the Minister of El Salvador, Francisco Alavi, who will be our president for this day of the Executive Committee session. I'm grateful to countries for their comments, and I just want to add that to what our director, Dr. Garcia Saiso, has already pointed out. This is the final report of the policy that was approved, but our technical cooperation in this topic will continue being provided to countries, because we have already pointed out that it is important for countries to have a health research agenda, develop their capacities so that investigation can continue, meeting all the ethical and methodological standards so that it will help countries develop their knowledge on health issues and also expand knowledge about the diseases that are prevalent throughout the region, supporting thus the development for producing health technologies in the region, and to conduct clinical tests and other types of tests also. So it is a very important topic, and it's going to need coordinated work of the ministries of health with other ministries and academia and institutions, and to be part of a process to build the region's capacity to conduct research, development, scientific advances, to have more capacity to better respond and do so more independently to meet the health needs of the region. Thank you very much, Mr. President.
Gracias, Director.
Thank you, Director. This discussion will be reflected in the final report, and with that we can move on to the next item, 7.8, Progress Reports on Technical Matters, Sub-item A, Increasing Production Capacity for Essential Medicines and Health Technologies, Progress Report. I would like to bring to the attention of the committee document CE 176/INF/8A, and I call on Maria Luis Pombo, who is the head of Innovation Access to Medicines and Health Technologies of the Pan American Sanitary Bureau. Please come to the head table to present this report. Thank you and good morning, Honorable President, distinguished delegates, Director. It is an honor to present this progress report on the implementation of the resolution CDR15 that focus on strengthening the regional capacity to produce essential medicines and health technologies, and also to move ahead in terms of intellectual property innovation. Now, this mandate is to improve access, to reduce external dependency, and to strengthen the health resilience of the region. During the most recent period, member states, with the support of the Pan-American Health Organization, have made major strides in areas like coordination, implementation of multi-sectoral policies, developing technical and regulatory capacities, and also promoting strategic partnerships. In terms of innovation and production, we have identified significant progress, including investment, development of national programs in Canada, Brazil, Colombia, Mexico, and Cuba, and also promoting strategic strategies and innovative technologies like the development and production of vaccines using different technological platforms, including the messenger RNA. Now, Mexico has worked with the technology transfer and the medicines patent pool by developing capacities in the region or concrete commitments in terms of access in cases of emergencies. Another milestone was approving a resolution from 2024 expanding the capacity of the regional revolving funds of PAHO to promote innovation and regional production. In parallel, 11 countries are strengthening their regulatory systems, and that is an enabling function to develop appropriate systems for production, and also have taken specific steps for regional and global recognition following internationally approved guidelines. Now, regional and national production has been strengthened thanks to an innovation in regional production platform, and also through subregional global partnerships as well as South-South cooperation. All of these efforts aim to consolidating a better integrated regional system that is consistent, that can respond in a timely basis to needs of public health. This report concludes with recommendations to continue along these lines by strengthening regulatory systems and consolidating a stable regional demand, also expanding the programs for transfer of technology and deepen the regional cooperation. This reflects the coordination, the commitment of the region to increase access to health technologies. Thank you. Thank you, Ms. Pombo. I call on the Executive Committee to take note of this report and to comment as the plenary sees appropriate. I now open the floor for discussion. Canada has the floor, followed by Brazil.
Thank you, Chair, and good morning, colleagues. Canada welcomes the significant progress outlined in this report and supports continued efforts to increase regional innovation and production capacity, improve regional coordination, and strengthen national regulatory systems. Canada recognizes the importance of health technology assessments when making decisions on how to allocate limited resources and welcomes the efforts to expand their use highlighted in this report. Canada recognizes the critical importance of improving equitable and timely access to health innovations and technologies to increase health outcomes in the region. As shown by our $50 million financial contribution toward the development of the PAHO regional platform to advance the manufacturing of COVID-19 vaccines and other health technologies in the Americas, Canada continues to advocate for the potentials of regional cooperation as a useful programming tool for targeted responses to regional health challenges by fostering innovative solutions and resources in the Americas. Thank you.
Thank you. I give the floor to Brazil, followed by El Salvador. Thank you very much, Mr. President. Brazil appreciates this report presented by Pajo on a strategic agenda for the region. As is acknowledged in the document, Brazil has been strengthening its industrial and technological health policy with structuring programs that foster our ability to produce medicine, essential technologies, and vaccines. Allow me to highlight some of the actions in the country. Through development and innovation programs, the Ministry of Health has supported international partnerships to develop a tetravalent vaccine, single dose, with the 4 serotypes of dengue. Also, productive capacity for the transfer of technology, and guaranteeing that over the next few years, Brazil will have the technological knowledge and the productive capacity so as to deal with pneumonia in newborns. And here we salute the efforts made by Pajo to strengthen collaboration networks and promote technical training and support the strategy. Also, we reiterate the commitment of Brazil in terms of providing equitable access. That is something that was launched during our chairmanship of G20, and there we had a policy to reduce inequalities and increase access. Again, we see that health as something that requires national cooperation. It is true that health is a public good that requires a collective and sustained effort. Thank you. Thank you, Brazil. I now give the floor to El Salvador. Thank you very much, Mr. President. El Salvador welcomes this report, and we consider that it's important to continue to strengthen regional capacity in terms of regulations to generate resilience and also innovation in the production of new health technologies, in parallel with strengthening governance and of intellectual property so as to facilitate transfer of technologies to the region. Thank you. With that, I give the floor to Mexico, followed by Panama. Thank you very much, Mr. President. The Mexican delegation takes notes of this report, of the progress report on increasing production capacity for essential medicines and health technologies in keeping with document CD 59.8, and since local production in and of itself does not meet regional needs, the Secretariat of Health in Mexico, through its general director, has a guiding function by implementing a sectoral roadmap. This instrument allows us to work towards modernizing the healthcare system, making systematic evaluations, introducing innovative technologies aligned with efficiency, transparency, and equity. With a multi-sectoral governance model, the efforts to modernize the health sector works with industry, academia, civil society, and work on validation processes and prioritizing different initiatives for transfer of technology. Each proposal goes through a cost-effectiveness analysis so as to make evidence-based decisions. Here we recognize the importance of institutionalizing ways of evaluating health technologies, so we are working to strengthen our connection with the Network on Health in the Americas. This allows adoption of best practices so as to develop essential health technologies. Lastly, and as part of the regional collaboration strategies called for in the resolution, we feel that the modernization of the health sector encourages entering into agreements with international organizations and working with subregional platforms. This promotes the use of regulatory frameworks and strengthening local capacity, assuring the sustainability and equitable access to critical technologies. Thank you. I give the floor to Panama. Thank you very much, Mr. President. The delegation of Panama welcomes this report that presents regional guidelines for strengthening research development and transfer of technology, as well as the production of health technologies to improve equitable access to these technologies. We appreciate the fact that this report was prepared. It analyzes public information that pertains to countries that belong to PAHO, and also there was a consultation to the offices in member states. This was done early in 2024 when preparing the final report on the policy for access and rational use of medicines and other health technologies that are strategic and high cost. Despite the diversity of activities, implementation in practice still faces obstacles, especially in terms of adapting to specific contexts and in providing cohesion amongst regional efforts. In fora, in meetings, we see that local production may be limited by infrastructure, training, the capacity in different countries. So we need guidelines regarding these initiatives so as to assure sustainable capacity. The challenge is to make certain that these initiatives will have a tangible impact on the production and distribution of medicines in low and middle income countries, the need to increase training, to strengthen regulatory ecosystems and improve the production infrastructure is critical. Also, international regional coordination requires continued consolidation so as to comply with recommendations, avoiding overlapping and using resources so as to make certain that local production will truly contribute to improving access and self-sufficiency. Thank you very much, Mr. President. Thank you. And with that, I give the floor to Argentina. Thank you very much, Mr. President. We appreciate this progress report brought to our attention. The diagnosis confirms that the region is moving towards an ecosystem that is capable of researching, distributing its own health technologies. However, there are gaps in investment, etc. Sometimes critical inputs are costly, and consequently, this can lead to an interruption in supply. Argentina feels that the best way to close these gaps combines market incentives with a state guaranteeing clear and predictable policies. It's important to share risk, mobilize capital, and accelerate the arrival of new productive platforms to the region. Recent experience in Brazil, Canada, and Colombia, where the ministries of health, the universities are co-financing plants and development lines, show that this model does work and can increase installed capacity in a short period of time. It is important to also modernize our regulatory system, something that has been promoted by PAHO. We have to place technological transfer at the center of our agenda. The report talks about revolving funds to deal with demand and also an effort to include value chains at the local level. Only in this way will we make certain that knowledge will flow and that good manufacturing practices will be shared and that the benefits of innovation will reach all countries, even those who have smaller scale markets. If we move ahead together, decidedly, these principles will become true and long-lasting benefits for our countries, reinforcing mutual trust, consolidating regional cooperation, making certain that each country has the necessary capacity to protect the health of its population. Thank you. Thank you, Argentina. On this item, we are going to hear from a non-state agent, so please go ahead. Here we're talking about neglected diseases, an initiative to deal with neglected diseases.
Of Drugs for Neglected Diseases Initiative, DNDi, we welcome the progress report and reiterate the critical importance of strengthening local and regional production capacity to ensure access to essential health tools, not only in the context of pandemics, but also for endemic and neglected diseases. Regional production efforts must be linked to needs-driven innovation supported by enabling policies, regulatory convergence, and access-oriented frameworks. We urge PAHO and member states to engage actively in the Global Coalition for Local and Regional Production and Innovation launched at the G20, ensuring it reflects public health priorities and includes diverse regional stakeholders so that it can evolve into an impactful and sustainable platform. South-South cross-regional collaborative approaches should also be explored. For example, DNDi participates in the Dengue Alliance along with other research institutions in Brazil, Malaysia, Thailand, and India, aiming to accelerate the development and production of accessible treatments for dengue, a major climate-sensitive disease in the region. Muchas gracias.
Thank you. Now I offer the floor to Ms. Pombo for her to respond to the comments that she received. Thank you very much, Mr. President. Well, first of all, I wanted to thank all of you for your statements. Canada, Brazil, Salvador, Mexico, Panama, Argentina, and DNDi. We are taking note of your statements so that we can reflect the commitment, the collective efforts that we have had so far, and also the appeal by several speakers calling for PAHO to always be present to promote a dialogue that will be consistent and work towards improving health in the region. I really don't have all that much to add right now, but I'm certain that our director may have other issues that he wants to comment on. But I would like to point out that the collaboration that we have established during the last 2 years, working with Canada especially, allowed us to exchange good regional practices in different areas. And we see that regional production goes hand in hand with having appropriate ecosystems that underpin the sustainability of these efforts. That's something that is worthy of mention. That has attracted other collaborators, so I really want to thank the team for that collaboration. Director, do you have any comments that you would like to make? Yes, Mr. President, I do.
Thank you all the very important comments that were provided by our member states. I also want to join Mariluz Pombo and to thank Canada for the generous contribution that Canada made to support the regional platform. The regional platform was established after member states approved this resolution that clearly stated that we need to present a proposal to respond to the extreme vulnerability that we identified during the pandemic. Remember that during the pandemic, we didn't have access to protective personal equipment at the beginning, and we are talking about simple products. We are talking about gloves, masks, and others. We struggled to have access to respirators, to medicines, to vaccines. So it was clear that we need to move forward, strengthen the regional capacity in our region, that we need to think about the feasible projects, because I think that the situation was so dramatic that the first response was, I want to produce everything. So almost every country in the region wants to produce vaccines, for instance, and we know that this is not feasible. So the regional platform is a mechanism that can allow the countries to come together, talking about and coordinating projects that will benefit all the countries in the region. So it's very important that the last point that you discussed, because sometimes about the research, for instance, that some countries that need to be ready to participate in clinical trials, other countries need to be ready to produce syringes, other countries need to produce the components that are part of a vaccine, that 2 or 3 countries can join together to produce PPEs or to produce medicine. So the idea of the regional platform is to give opportunity to the country to strengthen their capacity, but thinking about the regional initiative. you know that this vulnerability was not perceived only in our region. Other regions, they asked the PAHO, for instance, to learn from our experience. I signed an agreement, a memorandum of understanding with the Africa CDC, that is an institution that was established by the African Union, so it is linked to the heads of state. And the interest from the African CDC is exactly because they realize that if they don't have a regional market, they will not have feasible projects to develop vaccine production in Africa. So I think that this is one example. We have other regions. The Eastern Mediterranean Regional Office of WHO also asked us to share with them the same knowledge and the same experience that we have in the region. So the resolution in some of our member states highlighted that we need to cover different aspects of this. First, we need to strengthen our regulatory capacity. I mentioned during my initial remarks here that we have a challenge, and I really want to ask the 6 countries that have reference regulatory authorities. We are ready, and we are already working with them, because they will need to be assessed by the global benchmarking tool until 2027. If we don't have this, we probably will not be able to show to the region and to the world that the regulatory agencies, the regulatory authorities in Latin America have moved forward and have strengthened their capacity. So I think that we are working with you, and every time that I visit one of these countries, when I have the conversation with the government, I highlight how important it is to be ready to invest. We are performing an assessment that can identify what are the gaps, so we can establish a support to these countries in order to achieve the standards that are required. For this process, it will also be fundamental to have the technical support from the 2 agencies that you have in the region, the Canadian Public Health Agency, and also from the FDA. We are also asking for more technical support that we can have, because if we don't have these agencies qualified as at least level 3 during the assessment, I think that we will not can really talk about strong regulatory capacity in the region. Second is how we can continue shaping a regional market. The resolution that you approved, the member states approved last year, facilitating some flexibilities to provide a better use of the funds to support the regional production. I think that's moving forward. The resolution was approved in the last week of September, first week of October. In January, we signed the first agreement based in these flexibilities with the government of Argentina, with a private producer in Argentina, Synergion, and a U.S. producer, Pfizer. This is facilitating the tech transfer process to Synergion, and at the same time is allowing our countries to have access to the PCV 20 by the more affordable price in the world. We have a study showing that for some countries that now are using PCV 10, we are offering PCV 20 by $2 less by dose. So we are offering a reduced price for these countries. So some countries have already started offering the PCV 20. When I went to Panama to launch the vaccine week in the Americas, one of the announcements that the First Lady and the Minister of Health did during the event of the vaccination week of the Americas was exactly announcing that they were introducing PCV 20 vaccine. So things are moving fast, but I do believe that you can move it faster if you can come together and to discuss projects that are feasible, that can use the capacity that we already have in the region, in some countries, how we can present these projects and can strengthen them. And finally, that we need to bring the private sector to this conversation in a more participatory manner. We had a very good conversation with some producers of health technologies, vaccines, diagnosis, medicines, in a think tank here in Washington. In this discussion, they raised an idea that we are moving forward to invite them to a kind of an open dialogue about the projects, about how they can participate more in the revolving fund, how they can join with some countries that want to establish partnerships to tech transfer processes, support to development. I think that we are in a moment that we really need to bring them, we need to bring the private sector to this conversation in a totally transparent way with no conflict of interest. But if they are not part of the conversation, I think that we cannot have this fragmented situation that we have in the region. Sometimes the same producer is going to 5 or 6 countries to offer the same tech transfer. This is not feasible. I don't know if the government realizes this. It's not feasible that we will have 3 or 4 or 5 producers of the same vaccine in the region. If I don't know, a student of economy performs a assessment about the market, you will tell the government, please don't do that. You waste your time and the limited resources that we have. So it is really important to move it together, to offer projects that we will mobilize the private sector. Alify is here, and we are maybe having some events in the region, maybe one for Mercosur countries. We invite in the private sector to present the funds, what are the criteria, how they can participate, because this is an opportunity to increase their capacity. If they are able to have access not only to the national market, but to the regional market, they can increase the quality, they can increase their capacity to produce more, so we will have the region as a whole better prepared. And finally, also, I want to congratulate Brazil for the Global Coalition for Local and Regional Production that was launched during the G20 meeting and was formalized during the World Health Assembly. I have already communicated to the Ministry of Health of Brazil that we are ready to join the coalition as an international organization that can provide technical support, technical guidance, that can facilitate the process, because it is really a problem that we need to address. For some neglect, tropical diseases, and dengue is, I think, that a very clear example that was mentioned also by the representative of the DNI, that we have limited the production of vaccine, that we have no antiviral that is effective for dengue. And dengue, last year that we had a historical outbreak, we had 9,000 deaths related to dengue, more than 9,000 indeed. So, of course, that with better clinical management, we can reduce these deaths, but it's not acceptable that we have this number of deaths happening in our regions. We really need to improve diagnosis, we need to improve tests, we need to improve medicines and vaccines. So Pan American Health Organization is ready to participate, to provide the support, because this is really a very important initiative. Thank you. Muchas gracias, señor presidente.
Thank you very much, Dr. Barbosa. I would like to inform the committee that the discussions will be reflected in the final report. Agenda item 7.8, progress reports on technical matters, sub-item B, PAHO Gender Equality Policy Progress Report. I would like to bring document CE 176/INF/8-B to the attention of the committee and invite Dr. Jerry Eichmans, Director of the Department of Social and Environmental Determinants for Health Equity of the Pan American Sanitary Bureau, to come to the head table and introduce this matter, this point. Doctor, thank you very much.
Executive Committee members and participants of this Executive Committee, Director. This progress report provides a review of the advances and the challenges in the implementation of the 2005 PAHO gender equality policy during the period of 2020 to 2024. The analysis is based on data collected from member states and on the final report of the evaluation of the integration of gender equality in the Pan American Health Organization Technical Cooperation in Health in the Americas 2005-2023. The period covered in this report was heavily influenced by the COVID-19 pandemic. As women make up the majority of the health workforce, they faced greater exposure to the virus. They also experienced increased job losses, increased workload at home, and challenges in balancing caregiving responsibilities with their professional lives. Additionally, the social isolation, intensified domestic violence, and restricted access to support and health services, further impacting women's physical and mental health. Still, progress was made during this period between 2020 and 2024. Member States, with the support of the Secretariat, have continued to work to strengthen capacities to implement policies that improve the health of women, including measures in the health sector to combat domestic violence. The evidence-based was strengthened to improved monitoring systems. Tools to assess gender gaps were developed and applied. Capacities were built, and diverse women organizations were more involved in health planning and implementation. However, much remains to be done. This report presents also recommendations for countries to improve the health of women and men and to advance gender equality and health equity with the support of the Secretariat, which include to better integrate a gender equality approach into health policies, to improve data systems, to better collect and analyze disaggregated data by sex to inform policy and decision-making, to establish robust monitoring and accountability frameworks with social participation to institutionalize gender equality in the health sector, and to engage women groups and civil society, especially those representing populations and women in situations of vulnerability, in shaping and monitoring health policies, and to foster intersectoral coordination. The Executive Committee is invited to take note of this report and to provide any comments it deems pertinent. Thank you.
Thank you very much. The Executive Committee is invited to take note of this report and provide any comments it deems pertinent. I will now open the floor to the plenary for discussion. The United States has the floor.
Mr. President, the United States appreciates efforts to implement policies aimed at protecting women, combating domestic violence, and enhancing women's representation and leadership in the health sector. My delegation wishes to raise several concerns with the progress report and clarify U.S. policy. The progress report contains numerous references to problematic and ambiguous concepts such as gender and diversity, gender perspective, and women and men and their diversity. We cannot accept this ambiguous language and suggest clear and concise language. When discussing sex-based distinctions, PAHO should reconsider the use of the term gender in all applicable policies and documents. We appreciate PAHO recognizes there are two sexes, male and female. A person's sex is unchangeable. The message President Trump has for the American children is that they are perfect exactly the way God made them. The United States has long recognized the biological differences between females and males require sex-specific practices in medicine and research to ensure optimal health outcomes and accurate research. Recognizing the immutable truth of biological sex is essential to ensure the protection of women's health, safety, private spaces, sports, and opportunities. Restoring biological truth to our efforts together at PAHO is critical to scientific inquiry, public safety, morale, and trust in this institution itself. My delegation is also concerned about the technical cooperation to 13 member states related to sexual and reproductive health referenced in the progress report. We must always support promoting optimal health without including abortion. In addition, we have concerns related to the references to cultural diversity in the context of access to COVID-19 vaccination in paragraph 11. This language is unclear, and we encourage more precise terminology. We also note the report identifies ongoing challenges such as insufficient data disaggregation, and we urge continued work to address this issue. We look forward to working with PAHO and other member states to ensure that all PAHO programs defend women's unalienable rights and protect biological truth by using clear and accurate language and policies that recognize women are biologically female and men are biologically male. Thank you.
Thank you very much, United States. Now I give the floor to Canada, to be followed by Brazil.
Canada commends PAHO for its continued leadership in advancing gender equality and health across the Americas. The progress report offers a valuable overview of achievements and ongoing challenges, and we appreciate the evidence-informed and equity-centered approach adopted throughout the document. Gender equality is a key pillar of healthy societies. Gender influences how people act and interact and impacts people's health outcomes, among others. Gender inequality exposes people to health risks and affects access to services, health-seeking behavior, and quality of care received. We support the report and its recommendations, which align with our domestic and international commitments to gender equality and health equity. We also strongly support the emphasis on intersectoral collaboration, civil society engagement, and data-driven policy and decision-making. Canada underscores the importance of strengthening disaggregated data collection and intersectional analysis to inform equitable health policies and programs. We also encourage a sustained focus on the operationalization of gender equality commitments, particularly in areas where challenges have been identified. To strengthen this work, it is essential to monitor measurable outcomes through institutional results frameworks and ensure that data is supported through robust documentation. Embedding gender equality objectives into performance indicators and systemically monitoring progress will help ensure that commitments lead to tangible, evidence-informed improvements in gender equality through health. We look forward to further details on how these challenges will be addressed through the management response to the external evaluation of the integration of gender equality and how they will be reflected in the PAHO strategic plan for 2026-2031. Thank you.
Thank you. Brazil is now recognized. Thank you, Mr. President. Brazil congratulates PAHO for presentation of the progress report and the efforts carried out by the organization to promote gender equality and confronting inequality in the Americas. We reaffirm our commitment to develop health systems that are equitable, universal, and sensitive to the different forms that can combat discrimination in access to health services. The report, as presented, is extremely relevant, underscoring the disproportionate impact of the COVID-19 pandemic on women and to emphasize the importance of disaggregating data and guarantees their social participation. These are the core of policies that are currently adopted by the Brazilian government under the leadership of our president and our Minister of Health. We want to develop an integrated health agenda for women, focusing on sexual and reproductive health and reduction of maternal mortality, especially among Black women, through an intersectoral strategy that coordinates the initial care and timely response to avoidable deaths. We have also acted to prevent violence and health care and treatment of chronic diseases, non-communicable chronic diseases. Recently, a program for reconstruction of dental reconstruction for women victims of domestic violence was undertaken. The initiative guarantees access to procedures for mouth reconstruction, but they also restore dignity, self-esteem, and capacity for social and economic insertion of these women. This policy is a concrete expression of Brazil's commitment with an integral, intersectoral approach to dealing with gender violence. Brazil, therefore, supports PAHO and member states to reinforce global health governance that is equitable without anyone behind, especially our children. Thank you very much. I give the floor to Chile. Thank you, Mr. President. Gender equality is not simply a condition of justice, but an indispensable consideration for healthy development in the Americas. The context of the period covered shows the fact that women were most exposed to impact by COVID-19, greatest unemployment, and domestic burdens. In addition to social isolation, which intensified domestic violence and limited access to health support services, which also had a major impact on the physical and mental health of women throughout that period. From that viewpoint, we appreciate what PAHO has done to provide targeted support and incorporate the gender perspective in policies and plans, so that these respond to the needs of all persons, prevent inequities, and give visibility to the population groups in a situation of vulnerability. We wanted to underscore the institutionalization of monitoring and evaluation tools to evaluate gender's perspective in health, as carried out by member states, and technical support provided by PAHO to achieve the goals that have been set forth. We know there's much to be done. The recommendations to deepen the cross-cutting focus of gender perspective in all areas of technical cooperation, guaranteeing fair participation of women in decision-making spaces in countries and in the organization, to invest in data, training, and financing to close the gender gap in health, are on the correct path to achieve equal enjoyment of the rights guaranteed to all. Thank you very much, Mr. President. Thank you very much. I now offer the floor to Dr. Eichmans to respond to the comments.
Very much for the comments. United States, we take note of your comments. Thank you very much. Canada, I want to also thank very much the support that we have received from Canada for decades on this topic to advance gender equality, and we will continue to work with you to advance this important agenda. Also, congratulations on the advances that you have made in your own country. Thank you very much. Also, Brazil, thank you for your supportive comments. We will continue also to work closely with Brazil, and again, we recognize the important progress that has been made in Brazil on the topic of advancing gender equality and improving the health of women in the country. Chile, muchísimas gracias también por
Chile, thank you very much also for your comments and for placing this topic that is so central on the country's agenda as well as that of the organization.
That was carried out to keep advancing the agenda of gender equality towards health for everyone, for every woman, for every girl, for every man, to make sure that we really have a region where everyone can benefit from health. So thank you so much.
Muchas gracias, director de...
Thank you. Director, would you like to comment? Yes, Mr. President, and thank you very much. Thank you to member states for comments. We take due note. This is a progress report, therefore there is still ongoing work. We know the topic is important in the region when we think about the indicators of domestic violence in the region. Domestic violence is frequently women who are in a situation of vulnerability, and when health services can perhaps be their first point of contact for protection measures to avoid new violences or repeated violence, and even the number of female homicides in the region by their partners at levels that are unacceptable. PAHO has provided a lot of technical cooperation to countries to train health services and organize them to identify and support the women victims of violence. There are other topics that draw attention in the region, such as pregnancy in adolescents. In many countries in our region, the numbers are comparable to African sub-Sahara, which demonstrates how the lack of access to information, to contraceptive measures can truly change the life of these girls and adolescents, as well as their families and communities. Maternal mortality is another issue that was severely impacted also by the pandemic. And there is a number of maternal death in the period. Unfortunately, there is a strong recovery process underway right now. And PAHO is currently working hand in hand with countries to reduce, not only to go back to where we were in 2019, that has already been achieved in many countries, but we want to even improve this figure and reduce maternal mortality even further, because it is perhaps one of the most sensitive indicators about access and quality of health services. And also, cervical cancer is also a topic. There are still 44,000 deaths of women per year of a cancer that could be practically preventable. If we think that half poor families in Latin America have only one adult with some income, and that adult happens to be a woman, we're talking not only about the individual suffering of these women from a cancer that is terrible, but we're also talking about children that orphaned and families that totally lose their capacity for survival and are in an even more dire social and economic situation. So there are many other examples drawing our attention, showing that we need to have policies to identify the barriers to access health services that can promote the access of women, especially women in a situation of vulnerability, in order to move forward with the health agenda in each one of the countries of the region and also the Americas. Thank you very much, Mr. President. Thank you, Director. I'd like to inform the committee that the discussion will be reflected in the final report. We continue with agenda item 7.8c, Cooperation for Health Development in the Americas Progress Report. I'd like to draw your attention to document 176 Inf 8A and invite Piedad Huerta, Director for Coordination of Countries of the Pan American Sanitary Bureau, to please come to the head table and present the point.
Muchas gracias, señor presidente.
Thank you very much, Mr. President. Good morning, delegates. This biennial progress report responds to the mandate of member states of PAHO to periodically report on progress in implementation of the Cooperation for Health Development in the Americas. The document focuses on three axes: the convening capacity to promote the cause, the intermediacy and knowledge sharing, and the creation of partnerships and mobilization of resources. PAHO has worked to promote cooperation between countries and to position health at the highest political level at international fora such as G20 and the UN General Assembly. We also have technical work with ENRO, AMRO, AFRO, CDC, and other regions, and we collaborate with subregional integration mechanisms. The report includes what has been done to facilitate PAHO and the sharing of knowledge and good practices through South-South and triangular cooperation partnerships with member states. Between 2023 and 2025, a period that is covered by this report, PAHO financed 17 cooperation projects and furthermore mobilized resources from other sources, diverse ones actually, including funds from countries represented here today. Through implementation of projects, the Bureau facilitated sharing knowledge and successful experiences between 31 countries in the region and territories, including interaction with subregional integration mechanisms in the region. The achievements of these projects are described in the report. Furthermore, in the framework of the PAHO Forward initiative, instruments and platforms were developed to increase visibility of technical cooperation achievements, promoting the identification, documentation, and access to experiences and good practices with the support of the organization. PAHO recognizes and broadly promotes the value and cost-effectiveness of cooperation among countries to develop health under the premise of solidarity and Pan-Americanism. Thank you.
Muchas gracias.
Thank you very much. The Executive Committee is invited to take note of this report and provide any comments it deems pertinent, and I now open the floor to the plenary for discussion.
Concedemos la palabra a
I give the floor to Canada, followed by El Salvador.
Canada appreciates PAHO's continued leadership and commitment to advancing health cooperation in the region of the Americas. We commend the comprehensive nature of this progress report and the clear demonstration of PAHO's efforts to promote South-South triangular cooperation as effective modalities in shared health challenges. Canada encourages PAHO to proactively pursue its collaboration with sub-regional integration bodies to optimize resources and results. Additionally, we encourage PAHO to continue strengthening the evidence base for inter-country cooperation by including more outcome-level indicators and impact assessments in future reports. Canada continues to advocate for the potentials of regional cooperation as a useful programming tool for targeted responses to regional health challenges by fostering innovative solutions and resources in the Americas. Thank you.
El Salvador has the floor. Thank you, Mr. President. El Salvador takes note of the report and progress, and we confirm with gratefulness that PAHO has been an integrating cooperation platform between all member states, encouraging South-South and triangular cooperation. We furthermore recognize its participation at the G20 meeting in November 2024, which gives visibility to the region and expands the panorama to generate more cooperation and collaboration with state and non-state actors, which is a benefit to the region. We're also grateful for the support received from PAHO in sub-regional mechanisms, such as in our case of Central America, the case being Comisca. Thank you very much. I now give the floor to Panama. Thank you, Mr. President. The delegation of Panama takes note of the report that reflects the progress achieved in the execution and impact of policy on cooperation for health development in the Americas. We appreciate the collaboration between countries to move forward in regional collaboration and dialogue in the health sector, underscoring initiatives with the institutions with SICA to continue advocating for cooperation between countries for health development and positioning of health at the highest level of the sub-regional agendas within the groups of countries that are associated with these entities. In this context, We must also reinforce regional governance with greater coordination between member states, financial sustainability of our activities, and investment in the technical operational bodies of the cooperation institution are essential to maintain the rhythm of our progress. It is crucial to reinforce strategies in critical topics such as environment, climate change, as these are cross-border challenges that require coordinated and efforts with solidarity. Health has no borders, so to reinforce regional governance is important to effectively face these challenges, promoting intersectoral, collaborational, and institutional. Only thus will we be able to successfully overcome emerging risks and guarantee the protection of our populations when threatened with natural disasters, epidemics, and environmental crises. Panama will be the pro tempore chair of COMISCA from July to December 2025. We reiterate our commitment to work together with an integral, inclusive, and sustainable vision to move towards a healthier, more equitable, and resilient region. It is only through collaboration, innovation, and shared commitment that we will be able to comply with our mission to protect and promote the health of our populations. Thank you very much, Mr. President. Thank you, Panama. We have a non-state actor who wishes to take the floor and it is from the DNDI.
Gracias, Mr. President. On behalf of DNDI, we welcome the efforts to strengthen regional health cooperation and encourage member states and PAHO to ensure that these efforts reflect the growing links between climate inequality and infectious disease burdens. Climate change is reshaping the distribution and impact of many infectious diseases, including neglected tropical diseases, in ways that disproportionately affect vulnerable populations. Regional cooperation must include research and innovation strategies to address these emerging needs and strengthen climate-resilient health systems. We also highlight the recent initiative led by the Brazilian presidency of the BRICS to establish a partnership on socially determined diseases. Although focused on BRICS member states, this proposal reflects priorities that resonate across the Americas and could serve as a model for broader engagement in regional cooperation on neglected and climate-sensitive diseases. We encourage PAHO and member states to seize this moment to promote collaborative models grounded in equity, regional leadership, and South-by-South cooperation. Muchas gracias.
Muchas gracias.
Thank you very much. I now give the floor to Ms. Huerta to respond to the comments. Thank you very much. I'm grateful to the comments of Canada, El Salvador, Panama, and DNDI.
Yes, we totally agree with your comments. I think that the subregional collaboration is fundamental in our efforts. And actually, in all of these projects that we have in place, we have the collaboration and the participation of the different subregional institutions throughout the different subregions in our continent. El Salvador. Tomo nota de sus.
Panama and DNDI, we thank you for your comments. We did take note of them. We're working with the sub-regional mechanisms, integration mechanisms. We have a report coming up later on this work initiative. We believe that we can enrich our report to better reflect the points that you mentioned. Thank you.
Director, ¿desea hacer algún comentario?
Director, would you like to comment?
Yes, and thank you very much, Mr. President.
We will present a summary about our work with the sub-regional institution that was highlighted by Canada and all the other speakers. I think that we are in a very good moment because we signed a memorandum of understanding with COMISCA and with the Mesoamerica project. So I think that we have aligned priorities, and we are coordinating efforts to avoid the duplication, competition. I think that we are really in a very good moment in this working together with Central American countries. I will sign an agreement with CARICOM in a couple of weeks, and we do believe that we can strengthen and to provide a better coordination with CARFA, with the CARICOM, to strengthen our capacity to provide the technical operation to countries in the Caribbean region. And also, we are advancing negotiations with the South American bodies. We have more than one in South America. We have one for the Andina region, we have one for the South Cone, and we have one for the Amazon basin. So we are coordinating with all the three ones. I just want to also to highlight that the South-South, North-South, and triangular collaboration is a very important part of our technical cooperation. PAHO has a strong presence at the country level, as you know. We have 27 country offices. I think that you remember that from the discussion about human resources that we are strengthening our capacity at country level, and these country offices are a very important platform to facilitate the bilateral negotiations among countries, to work on borders or to work on common problems that they have, as well as to facilitate the participation of stakeholders, partners that we have in the region and from other regions that want to provide more technical cooperation to countries in the region. In this regard, I also to thank also the US and Canada, because with the support that we received during the year 2024, we advanced several different projects in the region to reduce the maternal mortality, to increase the capacity to respond to public health emergencies, to eliminate malaria, TB, HIV, and other diseases. So I think that this is really a clear evidence that working together, the countries in the region, with the countries in the region, we can advance the health agenda and well-being in this region. Thank you, Mr. President. Gracias.
Thank you very much, Director. This discussion will be reflected in the final report. We're going to break for coffee at this point, and we come back at 11 a.m. Also, when we do come back, we will look at the pending resolutions. So we will see you back here at 11 a.m.
Este es el segundo taller que realizamos en Colombia con el tema de vigilancia integrada de epizootias y vectores en el contexto de la respuesta a la fiebre amarilla.
Recordemos que hace un año se inició la transmisión en el departamento de Putumayo y actualmente tenemos una afectación de 10 departamentos, 30 municipios, en los cuales ya se ha acumulado un número importante de casos y de ellos aproximadamente la mitad han fallecido.
En la región de las Américas, aquí en Colombia, solamente hemos encontrado casos asociados precisamente a ese ciclo selvático de la enfermedad, pero un trabajo muy importante de vigilancia significa precisamente evitar que eventualmente estos humanos infecten mosquitos urbanos y se inicie lo que se conoce como el brote, como una fiebre amarilla en ciclo urbano. Hasta el momento no se ha determinado ni se ha demostrado fiebre amarilla urbana en la región de las Américas en los últimos brotes, pero tenemos que estar atentos precisamente porque la urbanización con una amplia distribución, seguramente no habría una capacidad suficiente para controlarlo, ya que tenemos dosis limitadas de vacunas.
De allí la importancia de este taller, que nos permita generar las capacidades para la vigilancia de lo que denominamos las episodias, es decir, la identificación oportuna en qué momento nuestros micos se están enfermando o están muriendo y que por ende ellos nos están informando de una forma muy natural por dónde puede estar circulando el virus para otros poder organizar las acciones de prevención y control, y de ellas la más importante, que es la vacunación.
Es importantísimo esta vigilancia integrada. No solo tienen que ser los equipos de vigilancia, donde la vigilancia base comunitaria es fundamental, porque es la comunidad los que van a ser las primeros vigías que van a lograr identificar esto para poder llegar al sitio con los equipos de respuesta inmediata, con formación en epidemiología, hacer el estudio de investigación del primate, la colección de vectores y un estudio apropiado de cada caso.
El taller muy enriquecedor, las experiencias de los demás departamentos, de todos los profesionales de OPS, del ministerio, más que todo porque como referente de vigilancia basada en comunidad, aporta demasiado a mi conocimiento para yo poder transmitir a esas comunidades.
Considero que uno de los pilares principales para la atención a estas contingencias es el fortalecimiento de capacidades a todos esos profesionales que desarrollamos esas acciones en los entornos departamentales.
Este es un taller teórico-práctico, se hace una experiencia respecto a los mayores expertos que tenemos en la región. En el caso de este taller se ha invitado a personal técnico del Ministerio de Salud de Brasil, quienes están compartiendo sus experiencias de cómo hacer la toma de muestras en los cuerpos de los primates no humanos que se encuentran en la selva.
En Brasil hay una experiencia de más de 20 años con la vigilancia de epizootios. Esta estrategia, coordinada con los programas de inmunización, tiene sido la clave para el éxito del programa de prevención de fiebre amarilla.
Y me voy con unos grandes conocimientos para poder aplicarlos e implementarlos allá en el territorio.
Hemos aprendido mucho, sobre todo lo que nos interesa ahora es lo práctico, cómo recolectar las muestras de los primates no humanos en zonas alejadas.
Queremos es audar esfuerzos como salud, como medio ambiente, para que todo sea de una manera integrada y poder evitar más muertes por fiebre amarilla y conservar la fauna, que en estos casos serían los primates no humanos.
Es importante que la gente y las comunidades locales reconozcan la importancia de estos primates no humanos que están en el territorio y cómo es esta relación con la fiebre amarilla. Se ve que de pronto este va a ser un agente contagioso, siendo una víctima más de la fiebre amarilla.
Sin las comunidades no podemos hacer una respuesta efectiva y tenemos que dar siempre información clara para orientar mejor a la salida de esta emergencia.
El tracoma es la principal causa de ceguera infecciosa en el mundo. Afecta especialmente a mujeres y niños en comunidades rurales y remotas donde el acceso a servicios de salud, agua y saneamiento es limitado. Pero hoy estamos cambiando esta realidad. Gracias a una alianza entre la Organización Panamericana de la Salud y el Gobierno de Canadá, se han implementado acciones para la eliminación del tracoma en los países de la región. la Iniciativa para la Eliminación del Tracoma en las Américas no solo combate esta enfermedad, sino que también permite acercar atención integrada en salud a las poblaciones más vulnerables. Estos son algunos de los logros alcanzados en el segundo año de la iniciativa. Bolivia. En 21 comunidades indígenas remotas de Bolivia se realizaron evaluaciones rápidas de tracoma. Más de 4.000 personas fueron examinadas y más de 800 recibieron atención en salud, en servicios como salud visual, incluidas 17 cirugías de cataratas, salud bucal, pediatría, ginecología, salud materna, telemedicina, inmunización, medicina general y tradicional. También se promovió el lavado de manos y otras acciones de higiene y saneamiento. Brasil. En Brasil, la iniciativa visitó 750 hogares y examinó a 3.123 personas en búsqueda activa de tracoma. Se capacitó a 49 personas, incluyendo miembros de la comunidad, en salud, agua, higiene y saneamiento. Además, se formó a 22 comunicadores indígenas para promover la educación en salud en lenguas originarias, fortaleciendo la prevención del tracoma desde la diversidad cultural. Colombia. En Colombia, la iniciativa concentró sus esfuerzos en los 2 distritos con mayor prevalencia de tracoma, ubicados en el este y oeste del Vaupés. Se visitaron 256 comunidades pertenecientes a 29 grupos étnicos, con el apoyo de 11 equipos de trabajo en el terreno. Se capacitó al personal de salud y se ofrecieron servicios integrados que incluyeron atención en salud visual, diagnóstico y tratamiento de malaria, leishmaniasis, tungiasis y pediculosis, así como vacunación veterinaria y la desparasitación canina, fortaleciendo así el enfoque integral e intercultural de atención en salud en territorios indígenas. Ecuador. En Ecuador, 2 equipos de trabajo visitaron 8 comunidades en Taisha y Xuxufindi, donde se examinaron a 968 personas en busca de tracoma. Además, se brindaron servicios integrados de salud para malaria y chagas, aprovechando el acercamiento a las comunidades. México mantiene la eliminación del tracoma mediante vigilancia continua, prevención y atención de casos crónicos. En 5 municipios de Chiapas se realizaron acciones clave, incluyendo una jornada de cirugía para tratar la triquiasis tracomatosa que salvó la visión de 6 mujeres mayores. También se implementó un protocolo de vigilancia postvalidación y se promovieron hábitos de higiene como el lavado de cara y manos para prevenir la enfermedad. Guatemala es el país que está más cerca de eliminar el tracoma como problema de salud pública en la región. En Sololá se operó a 13 personas con triquiasis tracomatosa y se realizó seguimiento posquirúrgico. Además, se evaluaron 2.742 personas en 5 departamentos y se llevaron a cabo diálogos de saberes para intercambiar conocimientos entre comunidades y personal de salud. También se hizo un diagnóstico higiénico-sanitario en zonas prioritarias. Guatemala fue sede del entrenamiento de entrenadores, formando a profesionales de 6 países en encuestas de Tracoma Plus. El Salvador. En El Salvador se evaluaron 139 personas en la comunidad Cantón El Rodeo, Aguachapán, en busca de tracoma. Se capacitaron 12 profesionales para las evaluaciones rápidas de tracoma, formando 2 equipos de trabajo. Las actividades incluyeron pruebas de agudeza visual a mayores de 60 años y el monitoreo del Plan Nacional para la Prevención y Control de Enfermedades Tropicales Desatendidas 2024-2026. Perú. En Perú se realizaron actividades en los distritos Alto Amazonas, Mariscal Ramón Castilla, Requena y Putumayo del departamento de Loreto. Más de 200 profesionales de salud y líderes comunitarios fueron capacitados en la estrategia SAFE para eliminar el tracoma. 3 comunidades participaron en diálogos de saberes, fortaleciendo el enfoque comunitario. Además, más de 30 autoridades locales se comprometieron con la causa. Estas acciones se integraron con otras prioridades de salud como malaria, geogelmintiasis y dengue, ampliando su impacto en las comunidades. Venezuela. En Venezuela, la iniciativa avanzó en el estado Amazonas, donde se evaluaron 2.372 personas en busca de tracoma. Se realizaron talleres de prevención con 481 participantes, principalmente personal de salud. Se integraron servicios como salud ambiental, malaria, atención nutricional, salud materna y vacunación. Además, se reforzó la vigilancia de enfermedades como leishmaniasis, oncocercosis y tungiasis, y se desparasitaron a más de 2.000 personas. En total, las jornadas de salud integral beneficiaron a 4.642 personas en las comunidades atendidas. Estamos más cerca de eliminar el tracoma en las Américas, pero el esfuerzo debe continuar. Gracias al apoyo del Gobierno de Canadá y el compromiso de cada país, seguimos avanzando hacia un futuro sin tracoma. Juntos podemos lograr una América libre de tracoma.
Muchas gracias porque vinieron a nuestra casa a evaluar la vista de toda mi familia. Estamos muy agradecidos en nombre de toda la comunidad por la presencia de ustedes.
Dicen que hay lugares donde el camino se acaba, donde la carretera se convierte en mar y el viento en compañía. Pero también dicen que hasta allá llegan los compromisos más importantes, como el proteger la vida, para que nadie quede atrás. A la fecha, las coberturas vacunales sin influenza superan los 6 millones en población objetivo, colaborando esto con la disminución de casos graves y muertes por virus respiratorios. En el marco de la campaña de vacunación e inmunización 2025 del Ministerio de Salud de Chile y la Semana de Vacunación en las Américas, la OPS-OMS Chile, junto a un equipo del Programa Nacional de Inmunizaciones del Ministerio de Salud y autoridades regionales, emprendió una travesía hacia los rincones más australes del continente americano. 3 días, más de 4.500 kilómetros, un viaje impulsado por un propósito claro, una sola misión: llevar vacunas a quienes se encuentran en zonas aisladas o de difícil acceso en el país. Llevar vacunas a donde nadie más llega. Desde Santiago a Balmaceda, de Balmaceda a Coyhaique, nuestra primera parada. Allí reconocimos la clave del éxito de la vacunación en esa remota zona. Un equipo de salud altamente comprometido, que camina de la mano de líderes y lideresas comunitarias que convocan a mujeres y hombres, niños y adultos mayores para llegar a todas y todos. Además, cuentan con el apoyo intersectorial de las alcaldías, diferentes estamentos del Estado y la sociedad civil en general. La tradición de proteger a su pueblo a través de la vacunación es parte del ADN de Chile, desde las primeras campañas del siglo XVIII hasta la rápida y eficaz respuesta frente a la COVID-19. Nuestro país ha liderado con ejemplo, dejando una huella imborrable a nivel mundial. De Coyhaique partimos por tierra hasta Puerto Cisnes y desde allí zarpamos iniciando la travesía que nos llevó al corazón de comunidades apartadas. El equipo bordó ambulanchas, botes adaptados como verdaderas clínicas flotantes, para llegar hasta Puerto Gaviota, una comunidad a la que solo se accede por mar. Ahí, entre rocas, cerros verdes y mar indómito, se vacunó a niños, niñas y adultos mayores. El segundo día el equipo zarpó hacia Isla Gala, rodeados de volcanes y fiordos. Nuevas distancias, nuevos desafíos, mismo objetivo: proteger a la población. Cada dosis aplicada fue un acto de cuidado, una promesa cumplida, una señal de que la salud pública no tiene fronteras. Finalmente el equipo regresó a Coyhaique. Misión cumplida, vocación intacta. La travesía terminó, pero el compromiso sigue. Porque llegar a los rincones más alejados no es solo una meta logística, es una declaración: que nadie quede atrás, que la salud es un derecho y que en Chile se vacuna hasta el fin del mundo. Estamos seguros de que Chile logrará las metas establecidas por el país según las recomendaciones de OPS-OMS.
I have children at home. I have 4 of them, so that's the 5th one. And it's first time in life I have to come to hospital to get my baby. My name is Sandra Francis and I'm from Yarong Paro Village, the beginning of Region 9. It's actually like 160 kilometers from here to there. And I find it strange from being far from home. But now I'm comfortable and as you can see, I find it like living with others and finding new friends, you know, and mixing around and we learn from each other in there.
Region 9 is a very vast area. We have 62 facilities. We have 5 sub-districts, and each sub-districts have various other health facilities attached to them. The SIP program, the SIP Plus program, came into existence in Region 9. So we had an online training course, and then we had a face-to-face training where the facilitators from Georgetown came down. The region is doing well in terms of maternal death because we haven't had a maternal death like 3 or 4 years now.
We enter the data into the computer. Whenever we have admissions, we enter them into the computer. When you pull up that mother's information, you will find it there, but in a hard copy, something you might not find the card anymore. It might be put away somewhere else that you can't find it.
I've worked at Georgetown Public Hospital before the system was implemented, so I know how it was to use the paper base. And transitioning to the electronic base, I have to tell you, it has been like such a great thing for us. I actually have a great example of when the system was very helpful to us. So we had a patient come in, she was unconscious, she actually had a seizure, so she was diagnosed with eclampsia. Being able to look at the system, we could tell like what her labs were right away, we could tell what her blood pressure was before, we could get a very clear picture of her trajectory throughout the pregnancy and up to when she was. We were able to tell her gestational age, we were able to know if to give her corticosteroids and how to best deliver her. So in the end, she had a good outcome.
This has been quite a transformation for our department because prior to SIP, what we would have had is there was tremendous paperwork that had to be done.
When patients comes to admission, we used to have an increased surplus or increased volume of patients waiting for admissions. With the digital way, it's faster because physicians are pretty much aware of how the perinatology system works. So we input the information quicker and you don't have to do multiple copies in order to share to the different wards.
This is a very, very good decision-making tool in terms of maternal health policy and planning at the national and the regional level.
I think in Guyana over the last 4 years, we have made significant progress as it relates to reproductive health. We have PAHO, we have the Canadian government who has helped us. And so because of this assistance, we have accelerated what we've been doing. So I think in terms of sustaining what we've started, with our resources and with some help from our partners, we certainly would be able to sustain these gains.
My delivery date is anytime because I'm 38 weeks. Good. Yes. Yes. So I could feel my baby's really. I will stay. I have names, but I did not choose my baby name as yet. So when the baby born, then I will choose the names for my baby.
With the rising prevalence of non-communicable diseases, the Ministry of Health and Wellness Belize, supported by the European Union's Health Sector Support Program, EUHSSP, and PAHO, is proactively strengthening its health system. Through the development of targeted policies and collaborative frameworks, the nation is addressing these challenges on multiple fronts. From integrated primary care services, building capacity of healthcare workers, to empowering communities, strengthening health systems, saving lives.
In Belize, over the last 5 consecutive years, non-communicable diseases have been in the top 5 causes of morbidity and mortality for our country. So we knew that we needed to address this head-on. We were able to successfully launch our nutrition policy, and we're able to put a nutrition plan with objectives onto this policy.
And the support that is being provided to the Ministry of Health and Wellness for the development of the National Cancer Plan and the National Cervical Cancer Plan will also contribute to ensuring the management of non-communicable diseases.
By defining clear objectives and strategies, we are building a future where NCDs are effectively managed and the health of our population is prioritized. Integrated health service delivery networks are revolutionizing healthcare delivery in Belize. By ensuring comprehensive care at the primary level and bringing services closer to where people live, these networks are making a significant impact.
Through integrating the comprehensive management of non-communicable diseases such as hypertension, cardiovascular disorders, also mental health conditions, this really helps to strengthen the capacity of primary care providers and also community health workers in the knowledge and understanding of prevention and management of these conditions.
By standardizing care with global best practices and introducing new treatment modalities, healthcare professionals are better equipped to manage chronic illnesses. Health education is a crucial element in preventing and managing NCDs.
Through PAHO, we have been able to successfully, over the last 12 to 18 months, do caravans in some of the least accessible places, very rural communities that had significant population. So the health caravans were basically fair for the community to come out, learn more about health in different aspects. The blood pressure was done, your weight, your height, your body mass index. The pharmacist was there, nutritionists were there to give nutrition counseling. It was just an effort to try to improve health literacy in the hardest to reach populations.
By empowering communities with knowledge and education, we can inspire behavioral change and improve overall health outcomes. Access to essential medical equipment is vital in the early detection and management of NCDs. With the right tools, our healthcare providers are better equipped to serve the community.
There are a number of new blood pressure measuring devices that have come onto the market, but it is important to ensure that these are clinically validated so that the readings that we receive from them are accurate. In order to ensure that as we roll out the HEARTS initiative for the proper management and control of hypertension, we want to ensure that the equipment that are being used in the primary care facilities have been standardized.
The National Cancer Plan and the National Cervical Cancer Plan are groundbreaking initiatives aimed at reducing the burden of cancer across the country.
Through the EU project, PAHO has been able to give us tremendous technical cooperation for us to have a very solid and usable plan when it comes to reduction of all cancers, not just cervical cancer, but it's the National Cancer Plan.
The important thing about cancer and any cancer plan is to ensure that it is very comprehensive and covers the broad spectrum from prevention to rehabilitation and to care at the end of life. In addition to that, the clinical management. How do you diagnose? How do you manage these conditions? Which medications to use? So those are components that are also in the plan.
Together, with the support of our partners and communities, we are building a healthier, stronger Belize. One step at a time, we are ensuring better care for NCDs through integration in primary health care.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área da saúde. Isso aí, para mim, é como fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Amid a challenging security environment, vital work by the Ministry of Public Health and Population is strengthening routine immunization services in Haiti. Supported by PAHO and funded by the Canadian government through the Can Give initiative, these efforts seek to ensure equitable access to life-giving vaccines for vulnerable communities and groups, including girls and pregnant women. Through 3 regional exercises, 105 department-level trainers receive important updates on vaccination norms and protocols, including on COVID-19 vaccines, which have been integrated into Haiti's national immunization program. Through cascade training, these regional trainers then share their knowledge with nearly 400 health providers. In addition, 124 health providers involved in epidemiological surveillance were trained in specific protocols for surveillance of vaccine-preventable diseases. And 221 health facilities benefited from supportive supervision to ensure their compliance with vaccination quality standards. In 2024, more than 421,000 Haitian children received critical vaccinations through catch-up campaigns and routine services. And as Haiti faced recurring cases of deadly diphtheria, PAHO supported the vaccination of more than 340,000 children against the disease.
Oh oui, vaccin li gen an pile importance dans cadre routine et raison c'est parce que gen zone qui vraiment éloigné. Des fois, parents pas de possibilité pour les mener ti moun dans centre là pour les venir faire vaccin. Hein? Des fois, négligence parents tout et les nouveaux équipes sous terrain comme ça vraiment aider parents yo, aider ti moun yo pour capable faire vaccin dans localité côté que yo vivent là.
Parler des maladies évidemment par la vaccination, nous apprenons et diphtérie. Effectivement, c'est un cas de diphtérie suspect que l'équipe aidée là a fait réponse. Et nous en pleine activité de réponse, j'en ai remarqué, nous cherchons rougeole, rubéole, nous cherchons syndrome rubéole congénital.
Okay, to continue with our agenda, we are going to go to 4.5, Plan of Action on Non-Communicable Disease Prevention and Control, 2025-2030. I bring document CE 176/16 and PR 1, Plan of Action on Non-Communicable Disease Prevention and Control 2025-2030, to the attention of the committee. The amended resolution is circulated yesterday. It's available on the resolution tracking system. Since there are no changes other than those presented on Monday, the rapporteur does not need to reread the changes proposed. I understand that member countries have had the opportunity to speak informally about these proposed changes, and I offer the floor to make comments on these changes.
Concedemos la palabra a...
I recognize Colombia. Thank you very much, Mr. President. I wanted to say that Colombia defends multilateralism and always seeks a consensus. So we have heard from members of the committee, and we think it's important that we make progress on the prevention and control of NCDs. That needs to be aligned with the high-level meeting that is going to be held as part of the November meeting of the United Nations. However, regarding the changes in the text, we think that it is important that we align our actions in PAHO with the 2025-2030, and that we evaluate the progress of this plan within the broadest framework of sustainable development. Eliminating this reference, we think, is a backward step in terms of accountability. Also, recognizing inequalities in dealing with NCDs is essential to make certain that no person or no community be left behind. Now, NCDs do not affect all populations equally, and social and economic determinants especially affect the most vulnerable. So this would mean creating greater gaps and limiting the effectiveness of the plan. So Colombia, Mr. President, cannot support the changes, the amendments that were presented to the original text. Thank you.
Bueno, en esta situación tenemos dos posibilidades.
I give the floor to the United States.
Thank you very much, Mr. President, and thank you to the comments from my colleague from Colombia. Our delegation does not have flexibility on the proposed deletion related to the Sustainable Development Goals. However, we do have some alternative language to propose for the other deletion that we had suggested. So if it is okay, I could read that for the room's consideration. So this is for OP2B. So I'll go ahead and read. So instead of to substitute where we had deleted while addressing the inequities associated with NCDs, we would propose to replace that language with the following: while improving overall health outcomes for all individuals afflicted with NCDs. So perhaps I could read that again. So the language would read, while improving overall health outcomes for all individuals afflicted with NCDs. And again, this would follow the last phrase in OP2B after health and all policies. And I welcome comments from the room. Thank you.
Muchas gracias. En esta situación...
Thank you. Here we have the possibility of I offer the floor to see if there are further comments on these points under discussion.
Concedemos la palabra a Canadá.
I recognize Canada.
Thank you, Mr. Chair. Thank you to all colleagues for what we know has been a lot of back and forth on this one over the last couple of days in trying to achieve consensus As we noted in our original intervention, Canada was supportive of the original language that we looked at when we all arrived on day one here. Subsequent to the original amendments by the United States, Canada, although not loving the amendments and certainly preferring the original text as it was presented, but in the spirit of focusing our efforts on the plan itself and the important work and convergence and common objectives, I think in this room within the plan, we were willing to accept the original amendments from our colleagues of the United States. And for the same reason, we would be willing to accept this most recent amendment. Thank you.
Muchas gracias.
Thank you. I give the floor to Brazil. Thank you, Mr. President. Well, first, I wanted to thank the United States for a new proposal. For us, as we said already, it is very hard, as Colombia said, to remove the mention of the Sustainable Development Goals and equity. Those are very important issues for the region. We consider that this plan should take into account the diversity of the region with special attention given to persons in a situation of vulnerability. So I feel that perhaps with this new proposal, we would need a bit more time to consider the resolution. So perhaps we would ask for more time to consider this. I give the floor to Chile. Thank you, Mr. President. Chile appreciates this opportunity to discuss this. We agree fully with the original proposal. We would have preferred to avoid this discussion. However, with a view to moving ahead and reaching an agreement and to protect the health of our population in all of its diversity, we could accept the proposal of the United States. Thank you. I'm going to give the floor to the rapporteur so that she can read the entire text in Spanish. Thank you very much, Mr. President. I'm going to read the changes that were requested by the United States. Operative paragraph 2B. Create multi-sectoral partnerships and strengthen the whole of government response to NCDs, ensuring policy coherence across government agencies and prioritizing NCD prevention and control with health in all policies. And control with health in all policies while improving overall health outcomes for all individuals affected by NCDs. That concludes my reading of this proposed change, Mr. President. Thank you.
Bueno, debido a la petición de Brasil,
At the request of Brazil, Brazil asked for a bit of time to examine this, so we are going to leave this matter for after lunch. we can return to this after looking at other topics, and it's really important that we reach a consensus. I think that that is something that would benefit the entire region. So it would be important for us to be able to arrive at a consensus. So those countries that have made those comments, please take that into consideration. With that, I recognize Uruguay. Thank you. Thank you, Mr. President. I only wanted to support what was said by Brazil. I have no instructions, so I cannot accept amendments to the text, but I could talk to Montevideo about this situation. But the truth is, we do need some time, especially in this context where we are dealing with several events that have been scheduled for the region. So I will be talking to Brazil, and I will also talk to my authorities to see what decision can be made. Thank you. Very well then. While we discuss other agenda items, that could be 30 minutes, 1 hour from now, we can return to this topic.
Sí, creo que es muy importante dar esto.
It is important to give you time so you can consult your capitals to make a decision. And so in the meantime, we can continue with our agenda.
Bueno, continuaremos.
Very well. Let's go on to agenda items 7-9, resolutions and other actions of intergovernmental organizations of interest to PAHO. Subitem A, 78th World Health Assembly. I would like to bring document C-176/INF/9A to the attention of the committee. I invite Mr. Nicolás Lagomarsino, Senior Advisor of the Governing Body's Office of the Pan American Sanitary Bureau, to come to the head table to present this item. Thank you very much, Mr. President, and good morning, delegates. Good morning, Director.
7.9A on the 78th World Health Assembly, which was held this year from 19 to the 27th of May in Geneva. The president of the Assembly was the Philippines. Representing the region of the Americas, Colombia served as one of the 5 vice presidents of the Assembly. Panama served as vice chair of Committee B, and the Bahamas served as rapporteur of Committee A. Honduras and Peru serve on the Committee of Credentials. In addition to Colombia, the region of the Americas was also represented at the General Committee by the Bahamas, Colombia, Cuba, Ecuador, and Uruguay. The agenda of the Assembly included approximately 75 items and sub-items. A number of landmark decisions and resolutions were adopted, including the world's first pandemic agreement. Member states also approved the program budget for WHO 2026-2027, which includes a 20% increase in the CES contributions. The annex to the document we presented contains a list of selected resolutions and decisions adopted at the Assembly, as well as a summary of the implications for the region of the Americas. This document also contains highlights from the 157th session of the Executive Board, which was held immediately following the Assembly on the 28th and 29th of May. Panama was elected rapporteur for the Executive Board, and Panama will serve as in this role until June 2026, so it's a year appointment. Barbados, Chile, Costa Rica, El Salvador, and Haiti currently occupy the other 5 seats of the board that represent the region of the Americas. This concludes my presentation. Thank you very much, Mr. President.
Thank you. The Executive Committee is invited to take note of this report and provide any comments it deems pertinent. I open the floor to the plenary for discussion. El Salvador. Thank you, President. I would merely like to express our heartfelt thanks to the organization for having mediated through Ambassador Tovar of Brazil, reaching this pandemic agreement so that the Americas could coordinate and reach this milestone. Now, I wanted to thank the organization for supporting our country, allowing us to be part of the Executive Committee, and we feel that this reinforces the responsibility that we feel as a country to support public health policy in the region. Thank you. I recognize Brazil. Thank you very much, Mr. President. Brazil thanks PAHO for this report on the 78th World Health Assembly, highlighting the most important facts for the Americas, including the agreement on the Pandemic Pact, which is important at the global level, and it reaffirms the importance of multilateralism. Brazil is proud of having participated actively in the entire process, and also it is good that we saw a high degree of regional representation. We reiterate our firm commitment to this process, especially in the Intergovernmental Working Group for developing a system for access and benefit sharing. Now, the Pandemic Pact and its annexes are definitely going to strengthen the capacity of countries, allowing them to cope with persistent inequality responses and to respond to future health emergencies. Regarding Resolution 77-8, it is important that we support the regional office, and we think that we need better balance in terms of the lack of financing to the region of the Americas. It is important that there be coordinated mobilization of resources so as to assure coordination with global health, always focusing on efficiency, resilience, strengthening national systems. Mr. President, allow us to point to approving Resolution 79A regarding the digital substitution of breastfeeding. This was supported by Mexico, and it was co-sponsored by Chile, Colombia, El Salvador, Guatemala, Panama, Paraguay, Peru, Dominican Republic, and Uruguay. And this is an important step forward in terms of promoting breastfeeding, especially in view of the challenges that are represented by digital media. Also, we appreciate the support received from PAHO. It's important that there be coordinated efforts so as to strengthen the capacity of the countries of the region in dealing with this digital spread of information. Thank you. Thank you. I give the floor to Colombia.
Thank you, Mr. President. First of all, I'd like to thank you for the report submitted on the World Health Assembly. Secondly, to thank the region for providing Colombia this possibility of being part of one of the vice chairs of the World Health Assembly. Thirdly, to ratify the importance that after 3 years and truly with the leadership in the region and with Brazil, to be able to build a consensus. Specifically, Colombia offered an explanation of vote that we participated in the consensus, but we wanted to explain our vote in connection with the issue of a transfer of technology. But we welcome and firmly support the fact that the Assembly could conclude with a pandemic agreement. Also, we would like to welcome the protagonism played by the region on several issues, and we will not go through the list of them, but I'd like to draw your attention to an initiative that was submitted by Chile, which was widely supported in connection with the objective of dealing with the mental health, the social disconnection, a category that greatly illustrates the understanding of what is transpiring in connection with mental health in the world, particularly after the pandemic. So we are very grateful for that. We believe that this is an exercise that beefs up multilateralism as an essential tool and instrument for peace, for the progress and the progressive progress made on ensuring human rights in the world and the protection of these rights. Thank you. Thank you. And now we give the floor to Mexico. Thank you, Mr. President. Mexico would like to express its gratitude for the document, and we believe that this could be included as part of the document CE 176-EF/1 on strategic matters before PAHO or between PAHO and WHO in order to have an integrated, consolidated view on the issues in common between both their organizations. We take note of the resolutions and decisions made by the Assembly, and we believe that the implications for the region ought to be part of the main text and not only an annex. Likewise, we would like to appeal to you to promote a more strategic analysis regarding areas of opportunity for coordination between both organizations. Mexico reiterates its commitment with international cooperation on health, acknowledging the achievements made and celebrating the agreement on pandemics as an essential milestone in order to strengthen the global health architecture. We agree on the importance of aligning its implementation with the international health regulations and the regional strategic frameworks in order to maximize synergies and thus to be able to achieve an effective response before future pandemics and health emergencies. We believe that it is essential that this privilege, equity, social justice, and universality, ensuring that institutional capacities, epidemiological surveillance, access to essential supplies be made available to all countries, irrespective of their economic development or geographic location. And we also stress that the initiative on breast milk presented by Brazil together with us, which is essential within the work done during the first 1,000 days. Mexico appeals to PAHO and member states to continue promoting accountability and transparency in managing resources, emphasizing the populations and the groups in greater situation of vulnerability. The global challenges on health call for shared solutions and collective efforts with a solidary vision of global responsibility that will promote regional and international cooperation in order to be able to ensure universal access to health and to move forward to more resilient systems, equitable and fair. Thank you.
Muchas gracias.
Thank you very much. I now give the floor to Mr. Lagomarsino to respond to these comments. Thank you very much, Mr. President. Thank you very much to El Salvador, Brazil, Colombia, and Mexico for the comments made. Thank you very much, El Salvador. We also have El Salvador, Haiti, and Panama. These are the new members, the 3 new members of the executive board, as it is known in WHO, and I'm certain that we will be duly represented. The other countries are Barbados, Chile, and Costa Rica. With regards to the report itself, it is very important to hear the topic that was brought up by Brazil, the regulation of marketing and milk substitutes, and also mental health and social connectivity, which is a resolution that was brought forward by Chile and other countries. This report, since it is prepared immediately after the Assembly, the Secretariat took the 2 issues that to us were the most salient issues, the academic agreement and the issue with the budget with the increase of 20% in these contributions and the budget approved for the region. In the version to be prepared for the Council, we will include some additional resolutions that have significant implications for the region and that were proposals submitted by countries in our region. That is all. Thank you. Now, in connection with a comment made by Mexico, very welcome. We will look into this possibility. We have some precise mandates on some reports that have to be published in keeping with the mandate, but we'll see whether we can do this in taking a proposal and changing this and following the breakdown or the detail about the resolutions, and maybe we can look into how to deal with this and see if we can include it as a part of the main body of the document and not as an annex. And your recommendations are very welcome. That is all. Thank you very much. And I give you back the floor, Mr. President. Thank you. Thank you very much. Director, any comments? Yes, Mr. President, thank you very much. Very briefly, simply to express my gratitude for the participation of all countries in the region. During the World Health Assembly, we had the possibility of establishing good coordination with GRULAC. We held 3 meetings with the heads of delegations in order to facilitate the agreements on the authorities and the officers for the region during the World Health Assembly, and also to share information so that each one of the countries could have the necessary information in order to be able to make decisions on the important issues. I've already said this, but I would like to reiterate my gratitude to Ambassador Tovar from Brazil, who was our representative in the main body of negotiations of the pandemic agreement, a sensitive issue, a delicate situation that goes beyond mere health, and having a representative from the region with all the skill, the experience of Ambassador Tovar greatly facilitated a participation by our region. And to be able to come up with a consensus amongst the countries as was achieved. Not the consensus, I would say, but the position taken by most countries as was done at the end. We also had another issue, which was the decision on the budget of the World Health Organization. And once again, I would like to express my gratitude for the important advocacy done by the countries in the region in order to define in a more transparent way the criteria, and for the region of the Americas to be able to have a fair distribution of the budget. This is a realistic budget that was approved reflecting the current economic situation of WHO. And with the support of the countries in the region, in this debate during the Assembly, we were able to arrive at an equitable sharing, and more than equitable amongst our regions, which is a positive point for the region. But at the same time, let us recall that we're talking about a budget that is like an envelope, and now we have to make sure that the real funds that go to that envelope could also match and be given to the region of the Americas. Also, I'd like to congratulate the countries for the resolutions presented. Very important resolutions such as the issue of digital markets regulation that goes through an update, because we already had a resolution on the market for milk substitutes. But with the increase of internet, the fact is that if we see this in a completely free way, without any regulation in many countries, and even through social networks, so having regulation on this issue was also very important. I would like to thank Brazil and Mexico for your leadership, and Chile and the other countries in the region because of this issue of the social connection and mental health, which I believe is extremely important. This is a novel issue, but no doubt a very important issue, and we have to see how the health sector, in coordination with other sectors of society, can deal with an issue that might affect, and which undoubtedly is already affecting the mental health of our young people, our adolescents, and our adults as well. So I believe that this was a very good participation from the region at the WHA, and I feel very pleased with the active participation and the good coordination that we were able to establish in an environment that posed complex issues for discussion, such as the situation with the May Assembly. Thank you very much, Mr. President. Thank you very much, Director. I would like to let the committee know that this will be reflected in the final report. And now we move on to the next item. 7.9, little b, subregional organizations. I'd like to draw your attention to 176 INF 10B, and I invite Ms. Piedad Huerta, Director for Country Coordination and Subregional Coordination Office of the Pan American Sanitary Bureau, to please come to the head table. Ms. Piedad Huerta. Thank you very much, Mr. President. The purpose of this document is to inform governing bodies of PAHO about agreements and resolutions that have to do with public health as they stem from integration mechanisms as of the last report submitted in 2024 within the framework of subregional integration processes of interest to member states. Likewise, we would like to report on the progress made on the activities carried out as a part of the agreement signed between PAHO and the integration entities at a subregional level. The subregional organizations play a key role for cooperation between and among countries and in order to coordinate the answers to the challenges shared in the health agendas and for the progress made on the objectives and targets of the plan that was approved by you. In order to be more strategic and achieve a greater impact of our cooperation with the subregional integration mechanisms, we have been working hand in hand with the mechanisms of the three subregions in the development of cooperation strategies for each subregion in such a way that in May, the subregional strategy for technical cooperation was signed with Central America. And it was signed between our director, the executive secretariat of Comisca, and the executive director of the Mesoamerica project. In July, we will sign a similar strategy with a CARICOM between the General Secretariat of CARICOM and our director. And underway, we have the development of the strategy for South America that we hope will be signed in September in the course of the Directing Council. The report before you acknowledges the resolutions and decisions made in the subregional integration mechanisms in articulation with the resolutions approved by you within PAHO and within WHO. For example, the elimination of diseases, the preparedness for emergencies and potential pandemics, and the integrated approach of non-communicable diseases inter alia. We would like to express our gratitude to subregional mechanisms such as CARICOM, Comisca, the Mesoamerica Project, or as a UN, Vodka and Mercosur, for the strengthened partnership with which we are working. Thank you very much. Thank you very much. I now give the floor. And before that, we call on the Executive Committee, and therefore you're invited to take note of this report and provide any comments it deems pertinent. And now I open the floor to the plenary for discussion. Floor is given to Chile, followed by Canada. Thank you very much, Mr. President. Chile would like to express its gratitude for the possibility provided by PAHO to participate in different spheres. Looking at it from the point of view of a Ministry of Health, with the many tasks that we have ahead of us and that have to be developed for the benefit of our populations, working together with the different cooperation spaces is key in order to attain results in the international sphere, as well as in the joint work agreement in regional policies. And therefore, we greatly value the availability that the organization has put before us in order to work together with other cooperation spaces that have been created on an individual basis by the countries in order to be part of a regional, efficient, and effective response. Thank you very much, Mr. President, and also thank you to PAHO. Thank you very much, and now we give the floor to Canada, and followed by Argentina.
Thank you very much, Mr. Vice President. Canada takes note of the report and thanks PAHO for its transparency and its commitment to keep member states informed of its engagements at various levels across the region. Canada appreciates the importance of the role of sub-regional integration entities. PAHO's leadership in promoting regional solidarity is evident in the breadth of items presented in the meetings of these organizations. We also thank PAHO for its continued commitment to improving the health situation of the Caribbean, Central American, and South American subregions through context-informed policy-making support and technical cooperation to various organizations and partners. Canada and CARICOM are strategic partners, committed to close collaboration across multilateral forum. We are pleased to note the development of the new PAHO cooperation strategy in the Caribbean to guide technical cooperation between PAHO and CARICOM member states. Further, Canada is pleased to note the national areas of interest that align with those of the Caribbean, Central American, and South American subregions, including climate change. On this, Canada looks forward to the new edition of the Caribbean Action Plan on Health and Climate Change 2025-2029. Canada encourages PAHO's engagement with these sub-regional entities to remain aligned with its new proposed Strategic Plan 2026-2031. Thank you.
Thank you very much, and now we give the floor to Argentina. Thank you, Mr. President. Argentina takes note of the report, and within technical cooperation at a sub-regional level, we greatly value the space of the Mercosur space as a platform for cooperation in order to strengthen health systems in the region and to jointly be able to raise the level of health of our citizens. During the pro tempore chairmanship of Argentina, we developed a whole set of workshops on new technologies applied to health, judicialization of the health issues, healthy nutrition throughout all stages of life, and problems of the digital environment during childhood and adolescence. At the 56th regular meeting of Ministers of Health of Mercosur and Associated States that was held on June 13th in Buenos Aires, the pro tempore presidency was transferred from Argentina to Brazil, and we approved the following agreements and declarations. A declaration on the judicialization of health in Mercosur, agreement on syphilis in states party to Mercosur and Associated States, a declaration on actions for a healthy lifestyle all throughout the lifestyle and the life course, declaration on new technologies applied to health, a declaration on collaborative cooperation of arbovirus in Mercosur. Then the Ministry of Health in Argentina was interested in including in the regional agenda a review on the use of synthetic additives in food, a space for technical exchange in order to review and strengthen the approval criteria for new therapies, as well as mechanisms for fast-track mechanisms of approval, strict studies on vaccines in order to recover public confidence on immunization strategies, and the interoperability of data in order to improve our ability to respond when faced with common challenges. Thank you. We now give the floor to Brazil. Thank you very much, Mr. President. First of all, we'd like to thank Argentina for the pro tempore presidency of Mercosur. During the last meeting of Ministers of Health of Mercosur, our Minister of Health, Dr. Alexandre Padilla, in his statement reaffirmed the commitment of Brazil with regional integration and multilateralism, stressing the role of PAHO and the role of WHO in the promotion of global health. In connection with the matters of interest and for the presidency, pro tempore presidency of Brazil that begins in July, as was just stated, a minister said that follow-up will be given to the items proposed by the pro tempore presidency, such as health, digital health, ethical use of this intelligence with interoperability of data. Aside from the challenges posed by digitalization of health, the country will continue to lead healthy and safe borders in Mercosur with the support of PAHO and the Brazilian Agency of Cooperation in order to give continuity together with PAHO to collaborative surveillance of dengue in the region. The Brazilian presence ought to continue discussing a transformation of the ad hoc Committee on Mental Health in a permanent undertaking and to continue dealing with these other diseases. We will continue on intensification of vaccination and immunization campaigns in the region, strengthening regional production of drugs, and even with a cost that we're going through the second edition of the production of vaccines and progress in dealing with health issues between regions. We're very grateful, and we strengthen the importance of participation in PAHO at these regional levels. Thank you very much.
Muchas gracias.
Thank you very much. I now give the floor to Ms. Huerta to respond to these comments. Thank you very much, Mr. President. I'm very grateful for the comments made by Chile, Canada, Argentina, Brazil. And this issue, the issue of subregional cooperation, is closely linked to the previous topic that I introduced, which is South-South cooperation for development. there is a value in the work done together, the subregional value, but also the work that is done between and across regions. We have examples of the work that is done between CARICOM and Argentina, for example, or countries in the south together with countries in Central America. And this is part of the added value of Pan-Americanism and the work done by the organization. The approach in working on these three subregional cooperation strategies with the subregions is optimizing everybody's resources, the resources of the organization as well as your resources, to better focus the work that is being done in the subregions in order to be able to achieve faster impact and to be better focused in our technical cooperation work we do at a subregional level. We understand and we clearly see the importance of the issues of the subregional and the importance of the subregional integration mechanisms and the efforts that are being made. We respect all of this, but at the same time, we work in a consolidated fashion in order to quickly make it to the targets that we have set, since you, member states, are working with us and also with the subregional integration mechanisms. Thank you. Director, any comments? Very briefly, Mr. President, because I've already stressed enough how important this work is. It is work of coordination that we are carrying out. I mentioned the signature of our subregional integration strategy for Central America and the one that is coming with the Secretariat General of CARICOM, and perhaps, as was mentioned by Ms. Huerta during the Directing Council, the signature with the three institutions in South America. I would also wish to express my gratitude to the Ministry of Health of Argentina and to congratulate you for completing the Mercosur pro tempore presidency that has now been transferred to Brazil. And I stress the issue of Mercosur because Mercosur has been the subregion that invited us to take a look at an issue that no doubt does not only have relations with Mercosur, but with all regions, which is high price, high cost drugs, and the issue of judicialization of health, which happens in many countries. I had the possibility of discussing this with the minister, and it is also an issue of interest for Central America. So it seems to me that as of this proposal made by Mercosur, our funds are already working. We already have offers of products for some high-cost drugs on cancer that have already been made available to all countries. And the idea is to continue working on this and have more participation, because no doubt this is a concrete manifestation. If we have more countries participating, the conditions to negotiate prices become even better for all countries in the region. So I am very grateful. I commend you, and hopefully we can continue with this coordination between subregional coordination mechanisms and PAHO. Thank you, Director. I would like to let the committee know that the debate will be reflected in the final report. Let us move on to the next agenda item. 2.2. Representation of the Executive Committee at the 62nd Directing Council of PAHO, 77th Session of the Regional Committee of WHO for the Americas. I bring to the attention of the committee document 176-2, and I give the floor to the Secretary to introduce this agenda item.
Thank you, Mr. President. In accordance with Rule 54 of the Rules of Procedure of the Executive Committee, the committee shall be represented at sessions of the Council or the Conference by 2 representatives appointed by the committee from among its members. The committee may designate alternates in the event that either of the representatives is unable to attend the pertinent session of the Council or the Conference. The representatives of the committee shall be responsible for making appropriate reports on the actions and discussions of the committee, containing such information as may be useful to the deliberations of the Council or the Conference. Mr. President, thank you.
Muchas gracias.
Thank you very much. I ask the committee to please nominate 2 candidates in order to represent the committee at the 62nd Directing Council. Chile is recognized. Thank you, sir. Chile is pleased to nominate Guyana as president for the executive as president of the executive committee, says the delegate from Chile. She stands corrected. I apologize, says Chile. I would like to nominate you, Mr. President, El Salvador, because you cannot propose yourself. You cannot nominate yourself. So I'd like to do that and to nominate you as Vice President for the Directing Council. Hopefully you will accept it. Thank you very much. And now we ask you to please nominate 2 candidates to act as alternates. Canada is recognized.
Canada would like to put forward Ecuador and Uruguay as alternates. Thank you.
Muchas gracias. Informo al comité.
Thank you. Are we all in agreement with the 4 candidates, the 4 nominations? Excellent. And now I would like to inform the committee that these appointments will be recorded in the final report as a decision. Let us now move on to the next item. Item 2.3, draft provisional agenda of the 62nd Directing Council of PAHO, 77th session of the Regional Committee of WHO for the Americas. I would like to bring document C-176/3 to the attention of the committee, and I invite Mr. Nicolas Lagomarsino, Senior Advisor of the Governing Body's Office of the Pan American Sanitary Bureau, to please come up to the head table.
Gracias.
Thank you, Mr. President. I'm going to speak in Spanish. According to what is
Pido a la secretaria que informe.
I would ask the Secretariat to report on the rules related to this item.
In accordance with Article 12C of the PAHO Constitution and Rule 7 of the Rules of Procedure of the Directing Council, the provisional agenda of the Council shall be prepared by the Director of the Bureau and submitted to the Executive Committee for approval. Thank you, Mr. President.
Thank you. Now, we would ask Leo Marcino if he could please present the item. Thank you, Thank you very much, Mr. President. According to the rules of procedure just read by the Secretary, the Director puts to the consideration of the Executive Committee the provisional agenda prepared for the 62nd meeting of the Directing Council and the Regional Committee 77th session of the Regional Committee of WHO. The draft order of business is in Annex A of the document. The provisional agenda includes the habitual agenda items of the Council. Those matters that have to do with the rules of procedure, the appointment of committees, the adoption of the agenda or order of business. Those matters tied to the Constitution, such as annual reports of the Director, the election of member states for the Executive Committee, administrative and financial matters, many of which have been discussed by you this week. The Council will also examine all of the matters related to the policies and programs and the final reports and those situations debated by the Executive Committee at this session. Now I would invite the Executive Committee to ask or make any observation and to approve the proposed agenda in Annex B. With this, I conclude my presentation. Thank you very much. Thank you. We give the floor we open the floor to start the debate.
Bueno, procedemos ahora.
Now let's give the floor to the director to see if he has any observations to make. Thank you very much. The provisional agenda of the Directing Council that we have presented reflects what we have discussed here at the Executive Committee. And I'm certain that if there's any urgent matter that any state would like to raise at the beginning of that meeting, it can do so. But this is a preparatory process where we have to review all the different documents that we need for those debates that we will be holding. Thank you. Thank you, Director. Now I would ask the rapporteur to please present the proposed resolution to be approved by the Executive Committee. Thank you, Mr. President. I will now read the proposed resolution. Proposed resolution. Provisional agenda of the 62nd Directing Council of PAHO, 77th session of the Regional Committee of the WHO for the Americas, the 176th session of the Executive Committee, preambular paragraph 1, having examined the provisional agenda, document CD62/1, prepared by the Director of the Pan American Sanitary Bureau for the 67th Directing Council of PAHO, 77th session of the Regional Committee of WHO for the Americas, presented as Annex A to document CE 176/3, PP2, bearing in mind Article 12C of the Constitution of the Pan American Health Organization and Rule 7 of the Rules of Procedure of the Directing Council, resolves OP to approve the provisional agenda, document CD62/1, prepared by the Director of the Pan American Sanitary Bureau for the 62nd Directing Council of PAHO, 77th session of the Regional Committee of WHO for the Americas. This concludes my reading of the proposed resolution, Mr. President. Thank you. Now I open the floor to the plenary for us to commence our discussion. There not being any objections, the resolution is declared approved.
Bueno, prácticamente ya se abordaron.
We have pretty much exhausted all of the topics, but we do have one resolution pending, and I would like to ask whether we have a response from the different countries regarding this resolution. I open the floor. We could also allow more time to take this up within 15 or 20 minutes. Then shall we give you that additional time? Or would you like to go ahead and do it now? The floor is open. 15 minutes. At the request of Colombia, then we approve 15 more minutes. Now, it is very important for us to be able to conclude this session on a positive note, and we all know that the matter of non-communicable diseases, chronic non-communicable diseases, is a very important one. So let's focus on this. Thank you.
Katankou paralysie flas aigu, nous cherchons surtout Haïti et moun qui gen moins que 15 ans.
Bueno, continuamos con...
Let us proceed, and we continue with agenda item 4.5. I bring to the attention of the committee document 176/16 and the proposed resolution for this plan of action 2025-2030. I understand that member states have had the possibility of talking amongst themselves on these changes proposed, and now I give the floor to the plenary. Floor is open to talk about the different changes proposed.
Colombia.
Colombia. Thank you, sir. It has been a very enriching exercise to go through the different options. We believe that the proposal that has been presented by the U.S. provides us with a possibility of rapprochement. We still have two concerns lingering, and it is the following. If we move forward with the entire population, and we agree with that, in order to avoid any biases in some cases of a reverse discrimination, in improving the results, also for everybody, we believe that it is important to take into account that affecting the social determinants is essential in non-communicable diseases. So, I'd like to propose, this is a plenary that I bring to all member states and to the U.S. to please consider the following proposal, that in the drafting, the one that we have here, that we might add the improvement with the determinants or on the determinants and the results. That is to say, to add, or our suggestion is to add one word. That's one first thing, because it seems to us that this is a core issue, and we are going back to the same public expressions of the U.S. government when you've referred to ultra-processed food that play an essential role in determining non-communicable diseases, just to mention some of the messages that have been more disseminated by the U.S. and which we believe are extremely important. On the other hand, we would insist on this, and what we suggest is that this be limited to the discussion on non-communicable diseases, because yesterday we've already arrived at an agreement in order to hold a couple of intersessional meetings where we hope we'll find the possibility of discussing more in depth the issue of equity. That is all. I believe that we would be very close to reaching a consensus, and hopefully you can take this into account. And it is precisely to add the word determinant and results. Thank you, sir.
Concedemos la palabra.
We now give the floor to the U.S.
Thank you, Mr. President, and many thanks for the constructive dialogue we are having here today on this critical issue. NCDs is a very important priority for my delegation and including for Secretary Kennedy. And I appreciate the proposal that we received from our colleagues from Colombia to add the word determinants to our alternate amendment that we proposed earlier this morning. Unfortunately, my delegation is not in a position to take that addition at this time. We do see the value in the concept of determinants in the NCD arena, but we are not able to show any more flexibility on what we've proposed. So unfortunately, we can only put forward our amendment that we had proposed this morning as our final position. So thank you.
Concedemos la palabra.
We now give the floor to Brazil. Thank you. I wanted to express my gratitude to the colleagues for the proposals. And as was stated by our colleague from Colombia, This is an issue of utmost importance for Brazil as well as for the region. The issue of the social determinants is quite a relevant issue. And as has already been mentioned, we just launched a partnership on the elimination of socially determined diseases, which includes different diseases aside from communicable and chronic non-communicable diseases. So we would truly be ready to support the proposal by Colombia talking about social determinants. We agree in saying that the issue of equity is a matter that must continue to be debated. It is a basic issue, very important for global health and for the actions proposed, and also the issue of sustainable development goals at the SDGs, because being 5 years getting closer to the deadline, these are issues of great priority for our country and for our region. Since we're approaching 5 years to arrive at the end of the target for the SDGs, besides the fact that we want to reach a consensus, I would like to continue making headway on this. And we would agree with the proposal made by the U.S. to the effect of including and without adding the word determinants proposed by Colombia, believing that we could come to a consensus with that if we go along with that. And so I would ask Colombia to please consider to show some flexibility so that we can make some headway on this very important topic for the region. Thank you. We now give the floor to Canada.
Thank you. Thank you, Brazil, and thank you, Colombia, as well, for reminding us all of the collective priority that many of us in this room have on equity, on social determinants, and your efforts to keep reminding us of that over the course of this week. And as we move forward into the negotiations of the strategic plan, we appreciate the opportunity to be able to go a little bit more in depth on how member states take this matter very seriously. Thank you to Brazil for focusing, as we noted earlier this morning, on the importance of this particular plan at this time, and really appreciate the concessions being made by other member states and as communicated by Brazil just now. And we, Canada, are in the same position and would be grateful for member states to see this one through today, and to Colombia for considering joining us in consensus, while very much acknowledging the important points that were shared earlier.
Uruguay.
Uruguay has the floor. Thank you, sir. In just a few words, we would like to express our support for what Brazil and Canada have stated. We fully share the spirit behind their interventions. We don't have any objection in supporting the amendments proposed by the U.S. However, we would like to include the Colombian proposal. It seems to us that this is quite reasonable. And obviously, this is shared satisfactions here. There are no winners here. In a way, we all give up on something. So I just wanted to express this because I had asked for more time, but that is all I have to say. Thank you, sir.
Concedemos la palabra.
We now give the floor to Colombia. Thank you very much for your comments. For Colombia, it is fundamental to build consensus. It is essential for us. It is not a matter of sacrificing or losing principles. We believe that the vocation of the region is to make headway to move forward in achieving conditions of equity, equality, justice, equal access to health, and that encourages us, and that's why we're here. I'm interested in clearly stating this as a position by Colombia to saying that this issue of equity cannot be solved or settled with the alternative presented today, and that is why we agreed on a methodology and an additional effort to be made in order to work on this. This is a point that I wanted to highlight. But heeding the colleagues from Brazil and Canada and our colleague from Uruguay, and with the best will of being able to make headway in building this, we could join in this suggestion and to continue with the review, the debate, the analysis, and the construction altogether. Thank you.
Bueno, muchas gracias.
Thank you, everyone, particularly Colombia, Brazil, Uruguay, Canada, and the U.S. We will read out the proposed resolution with what was added by the U.S. with the addition of what was proposed by the U.S., and we now give the floor to the rapporteur. Thank you, Mr. President. I will now read the paragraph where the change was requested. It is OP2 little b. Build multi-sectoral partnerships and strengthen the whole of government response to NCDs, ensuring policy coherence across government agencies and prioritizing NCD prevention and control with health in all policies, with an approach that include the health of all policies at the same time that we improve the overall conditions of individuals affected by NCDs. This is the change as it will be reflected and as it was read by the rapporteur.
¿Tenemos algún comentario?
Do we have any comments? If none, then we would move to approve the resolution. Approved.
Bueno, pasamos al siguiente.
We move on to the next item, item 8, other matters. Director, do you have any other matter that you'd like to bring to our attention? No, Mr. President, no other matters. Thank you. Thank you. And now we give the floor to anyone else, any other delegate that might have any other matter.
Excellent.
I report to the committee that the debate will be reflected in the final report. Moving on to the next item. 9, closure of the session. Now, continuing with the closure of the session, I would invite the director to offer some closing remarks. Thank you, Mr. President.
And now President of the 176th session of the Executive Committee, Honorable Minister Dr. Francisco José Alábio Montoya, Minister of El Salvador, our rapporteur, Mrs. Cynthia Gabriela Yangua Armijos, and the Secretary of the Rectory of the National Health System of Ecuador, Secretary of Governing Bodies Meeting, Mrs. Mary Lu Valdez, Parros Deputy Director, distinguished member states, delegates, representatives of non-governmental organizations in formal relation with the Pan American Health Organization, fellow PAHO colleagues, esteemed ladies and gentlemen. It is with a wonderful sense of fulfillment that I am standing with you at the end of this session of the Executive Committee of the Pan American Health Organization. During these past 4 days, you have successfully navigated through 39 agenda items, including the approval of 9 resolutions, and the committee has taken decision about the 3 policy documents, reviewed the 3 progress reports and 2 final reports. As we come to the end of a productive week, I wish to extend my sincerest thanks and heartfelt appreciation to you all for your individual and collective contributions to delivering on this week's extensive tasks. Ladies and gentlemen, I would like to take a few moments to briefly recapture a few highlights of this week's deliberations. You approved the PAHO's Program Budget 26-27, which will be the first to be developed and implemented under the new Strategic Plan 26-2031 that will be discussed and approved during the Direct Council meeting in September. The PAHO's Program Budget 26-27 includes the proposed budget and the expected sources of financing the proposed budget by outcome. You also approved just now the resolution on non-communicable diseases 25-2030, which aims at reducing by 1/3 premature and preventable mortality related to non-communicable diseases in our region. You also decided on how to proceed with the proposed Strategic Plan 26-2030, the Strategy on Health and Migration 26-2031, and the policy on expanding equitable access to high-cost and high-price health technologies, which will continue negotiations and revisions in some key aspects. The Secretariat is available and will be ready to support these negotiations, providing the space that you need to engage on negotiations, provide all the support that you need. We know that it's a challenge that we have ahead because we have only 3 months until the Direct Council, and you have the summer in the North Hemisphere in the middle, but I do believe that with the spirit of Pan-Americanism that we have and the commitment, we will be able to make very important progress until the Direct Council. And please tell us what are the additional information mechanisms to establish conversations that you request from the Secretariat that we are ready to support you. The Member States also received a detailed financial report in the report of the external auditors for 2024, which showed the financial situation of the Bureau. I ask once again Member States to not only make timely payment of their assessed contribution, as well as their efforts to provide voluntary contributions and co-voluntary contributions to the organization can deliver in these agreed upon commitments. Furthermore, you received information on the implementation of the international health regulations, the implementation of the Shared Services Initiative by the Secretariat, and the monitoring of the resolutions and mandates of PAHO. It's clear that Member States renewed their commitment to the Pan American Health Organization and their efforts in reaching agreement in the discussion this week emphasize the trust and value you place on us. I want to personally thank Brazil, Chile, Ecuador, Guyana, Uruguay, United States of America, El Salvador, Colombia, and Canada. I think that we are in a moment with several changes in the world, in the global health scenario, and I think that it's very important that we show our commitment, as you demonstrated here, to even when we disagree in some concepts and some positions, but try to find common ground, to move forward and to allow the organization to receive a clear orientation from our member states with a resolution that will guide our work in the next period. Let me now switch to Spanish. Hemos revisado também.
We've also reviewed the report of the Audit Committee. The last one provided by Alan Siegfried, whom I thank for his dedication and his hard work over the years at the Secretariat. I'm very pleased that the external auditors, the first ones who presented from the Comptroller's Office of Chile, having issued, without any reservations, a report for 2024. I would also like to thank the General Comptroller's Office of the Republic of Chile for the work done thus far, including visits to country offices already made and those slated for next year. I was very pleased to see how the recommendations were quite objective, pointing out a number of processes that can be improved in the organization to ensure we are more efficient and that we uphold the highest standards of auditing and financial handling and management for organization. We have presented some amendments to the statute and the rules of procedure for personnel, as well as a report on HR management of the Pan American Sanitary Bureau. We have seen a reduction in the selection process, that is, in how long it takes actually to go through the selection process based on the HR model in the region. The selection process at the organization are always based on the merit of candidates, so that we can ensure that we have the highest, the most skilled personnel capable to carry out the technical cooperation that we do here. We've received reports from the Ethics and Investigation Offices, Internal Audit Office, as well as an update on prevention and response to exploitation and sexual abuse, PAHO. These are topics of the utmost importance for the Secretariat, as for all of the member states, and we always take a periodic review of progress. You've looked carefully at progress reports and final reports on a host of strategies and plans of action. We all agree that even if we continue to build based on our collective success, there's still much to be done to address ongoing challenges. I would like to convey special thanks and deep recognition to our Honorable President, Dr. Frank C.S. Anthony of the Health Ministry of Guyana, for his deft handling and presiding over the 176th Executive Committee over the last the first 3 days. I also thank our Vice President, Francisco Olabi of El Salvador, who presided today. I thank both of you for very effectively shepherding us through this process. I would also like to express our sincere thanks to the President of the Subcommittee of Planning, Budget Administration, Margarita Perez Villaseñor of Mexico, and our distinguished rapporteur, Ms. Cynthia Gabriela Yagua Armijos of Ecuador. I would also like to thank our Assistant Director, Mary Lou Valdez, for her dedicated effort, and the Secretariat of the Executive Committee for all of our staff, including the directing bodies, for their tireless efforts and their contributions. My sincere thanks to our very talented interpreters. Despite the fact that we speak so fast, we do that so that we don't waste time, but the interpreters still manage to capture and convey what we say to ensure that all the delegates can stay abreast of everything we are saying. And the translators who translated all of the documents of this meeting into all of the official languages of the committee, English, Portuguese, and Spanish. Now, as we bid you farewell, I would respectfully ask everyone for us to continue to pledge our commitment to Pan-Americanism, making sure that we make this hemisphere the healthiest we can. And I congratulate all of you for the work well done. Have a safe trip home to your respective homes. I'm sure I'll meet you perhaps at the GA of the UN or in meetings that we might hold in your countries. So thank you very much. I thank each and every one of you. Just a few words of thanks. Dr. Jagos Barbosa, Director of the Pan American Health Organization, the Secretariat, the Rapporteur, all of the governing bodies, everyone who had a hand in this session. I thank all of the member countries for your very worthwhile technical cooperation on the different topics that we addressed at this 76th iteration of the Executive Committee. It's very important for us to remember that all of the proposals approved are key to strengthen the technical support that this organization is going to make available as we tackle health challenges that arise, do so effectively and on a timely basis. It falls to us to define policies and priorities of technical cooperation and collaboration in health matters vis-a-vis countries of the Americas. With all the agreements we have reached, we are not only meeting that mandate, but we move toward improving health conditions of our peoples. I reiterate my thanks to everyone. It's been a true pleasure to share with you in this session with all of its triumphs. It's been a true joy to share with you in this, and I declare adjourned this session, and we will see you all soon.
Placer.